Hey, I'm gonna start doing this. Nights where I have insomnia, I'm just gonna stay up and call it insomniacs. And I'm gonna make an actual new photo folder for that.
Hey, that'll be perfect, man. That's the best time right there.
I'm gonna tell everybody who has insomnia, check in right now.
There's gotta be more of us that stay up late. There's no way.
Right.
Oh, there was somebody today who just said that lack of sleep was definitely one of their triggers. Some new guy that I had looked up that Street Fighter name or whatever it was, and that he put in the chat, and I couldn't find it on Reddit. So if he's one of the ones that I sent a message this morning, he just must go by a different name on Reddit.
Honestly.
Yeah,
Yeah,
it's confusing.
yeah, I think it's like the meds, like for me the nasal once I'm awake, I get like a couple hours of just like craziness in my head afterwards and I'm like wide awake and I can't go back to sleep and then after this call it my second wind. After the second wind, I just knock out for so long.
Yeah, but after the nasal time, I get mad because it's like you come to it, it's like, oh fuck, how much time did I lose? How long have I been
Yeah,
gone? And yeah, I get mad. That's what keeps me awake first thing after the knee slam. And then, like you said, that little second wind, and that's that for a
yeah,
while.
I saw my message at 7:30 and I was like, oh my God, it's already 10 o'clock when I woke up. I was like, man, damn it, I missed the whole thing.
Nope.
No worries,
You can
Drew.
always
Too
have
long drive.
more.
We're almost
Oh
there.
yeah.
Yeah, we're
Okay,
getting out.
one sec. I'm gonna put the stuff on and then I will be right back.
All right.
I love watching traffic when people are driving. I love being awake when I'm
So
on
you
the road
went through
too.
the tunnel.
Hmm?
See when we went through the tunnel? That was really bright. Went through a real long tunnel at the beginning.
All right, hi guys.
All right. Kate left. She'll be back, of course. Um, how's it going, Sia? You said you had a seizure.
I did. My husband had to give me Nasolam again.
Was it in public?
Thankfully, well, I mean, I guess if you consider having it in a car, then
I was
yeah.
gonna say, yeah. No, that's not necessarily in public. Did anyone else see it in public?
When we were at the store parking lot, they probably did because it started when we were at the store while I was in the car, and then it progressed later on. So,
I love that you can smile about it. That's great.
hmm.
Not everyone will be smiling.
At this point, you kind of have to, you know?
Yeah. You took your night dose yet?
I did. I did. I took it at 10. That's my schedules from 10 to 10.
Same here, 10 to 10. I just forgot to take my B12. You cannot forget to take that stuff. Like it works really good. But if I miss one, I'm gonna feel the fatigue that I felt before I started taking it. So it's like something that you gotta keep taking.
You got to be on top of it.
Yeah. Now it's like medication. Now I gotta check the side effects and shit because it's like once you start it, you can't stop.
Yeah, I think I'm gonna start getting some of that too, because the one that I bought was like, uh, what's that called? It was like a mix, you know? It had a folate and B12 in it, and it had like a whole lot of folate compared to how much B12 it had. So I think I like overdosed on iron when I took the vitamins, and that's what ended up with me having a seizure afterwards. So this time I think I'm only gonna get the B12 and just try that.
So like, what do you have the gummies? Those are the best.
I don't, I have Yeah, let me
Some
show it to
capsules
you.
or something.
I have, like, I got the kids version of stuff, but
Kids version.
yeah,
Is
'cause
serious?
it always tastes better. Yeah, I'll show you what I got. This is
I
what
mean,
I
you're
got.
not that big anyway, so
Nah, I'm pretty small. This one, so this is vitamin B12 and folate, and it has 1,360 micrograms of the folate, and then it has 1,000 micrograms of the B12, and it's this one, methyl factors, it's called.
mm, never seen
Um,
that.
and I guess it's like these weird little like chewies. They're like uh the powdery chewy kind. It's kind of weird, but
How do
I'm
we
not
cheat,
gonna
man?
I'm not gonna take it again because it's got the folate in it, and I don't think I really need that anymore. I don't know what my iron levels are at right now, but I got a blood test with the neuro recently. I think that was like a month ago, and and it came back like completely clean. I think I told you guys about this. It came back like completely clean, which was like my first time ever having like a fully clean um blood test before, because all of the blood tests that I've had, even since when I was a child, they were all horrible. Like my metabolic um blood test was always like absolutely insane, low on calcium, low on magnesium and stuff, and low on potassium and sodium. And then my blood tests were always like back and forth. Like I had super low white blood cell counts for a long time. And then my red blood cell counts were always low because I was like chronically anemic, which I used to assume was from the endometriosis, but I'm like starting to wonder if like maybe that isn't the case.
Yeah, I just had this sushi today, and I was sitting there eating it the whole day, and I'm finally done. That's what I was eating. Yeah, sitting here
I got
early.
a I got a sandwich. It's just, oh my God, their sandwiches are so good. It's from this bakery here. And it had turkey, lettuce, tomato, and avocado, and then chipotle mayo on it. It
That
was
sounds good.
amazing. Yeah. And then we got a bunch of cookies too and a chocolate croissant. It was so good.
Oh, yeah, you make me hungry now.
No,
That's
no.
all. That's all I had was the sushi today. It was really good. It was a lot of it too. It
I
was.
miss sushi. We don't really have like a place to get that here.
You
I
can
guess
get
it's because we're
anything on
like,
Uber Eats or Instacart.
they don't even do that stuff here. That's how small of a town this is. The only thing they have is DoorDash, and it has to either be from Vaughn's or like one of the tiny little restaurants we have. We have two bakeries. We have like three Mexican shops, and their food is not even like legit Mexican. Like it's white people who own the place, and like it's cool and all, do your thing, you do what you love, but it's not good Mexican food. So.
What they call it, it's Americanized.
It's Americanized, yeah. Like there's this place right across the street from us, and they advertise themselves as a Mexican food restaurant, but the best thing there is a burger. So you can't
It's,
call that Mexican food.
but it's like they are tacos, but you get it.
I mean, basically, but then you're missing out on all the good stuff that comes with it. The
Right.
freaking salsa and the guacamole and stuff.
Yeah, you're missing all the good stuff, especially if you just, I can imagine just a taco chill, cook it on the grill, not knowing. I like how they make them. They make them from scratch, and then they just
Hmm.
reheat them. And yeah, this Mexican restaurant, Over here, it's pretty good. Like I said, their shells, they don't come out of packages. He
They
said,
make them themselves.
yeah, he said, I make the shells for the burritos and everything. And yeah, they even got this one burrito that they put hot Cheetos in. I never tried it, but it was just interesting to look at. It doesn't look like something I'd eat.
One of my husband's favorite burritos is the California burrito, which is it's got carne asada, um, sour cream, cheese, beans, and like all the regular stuff in a burrito, and then they put a whole load of French fries inside of it too, and it is so good.
I've never heard of that. That sounds good.
You gotta try it one day.
Uh, yeah, but this one over here, when you get it and they put the Cheetos in it, the hot Cheetos, they actually put the burrito in a hot Cheeto bag, the little hot Cheeto bag.
I see
So
what
you
they're
got
doing.
two
That's
little
vendor
hot Cheeto
style.
bags. Now you got two little bags and it's cut in half and yeah.
Yeah, my husband and I, we used to be super big because like I am Spanish from my dad's side, and then my mom's side is Italian. And then for him, he's like Colombian and Mexican. And so we like used to cook a lot of Mexican food, and I kind of had to stop recently because the carb intake, there's so many carbs and that stuff. But it's good still every now and then. Like tonight we had tacos. But but we used to try to like make our own stuff, and I think doing that ourselves, we kind of ended up with high standards on our food that we would get.
Yeah, I look back in my blood history or whatever. I have Haitian, Italian. Um, I forgot what it is from South America. There's another one. Um, I forgot what it is, but yeah, Haitian and Italian. And when I think about it, I was sitting here telling a friend, I was like, they don't have Haitian as something you can check on the box when you check.
No, no, you got to put it as other or mixed.
Right. They should do that. They should put different on there.
Yeah, for the longest time, my dad told me that I was only just Spanish, only. And because I don't know what his deal was with his Mexican side, but he was not happy with it. And he is very dark. He tans like super easily, so he's like people at school used to ask me, "Is that your biological dad?" Because like I am white, but my dad is like super dark compared to me. Um, but it's like a thing with Mexicans is that they tan very easily and end up turning very dark. And like we don't get sunburn, we just get tanned. And he would never tell me that we had Mexican in us until I did like a deeper dive on my grandma's history on his side, and come to find out that she was born in Mexico, and so her family is like Mexican, like fully Mexican, and then my grandpa is the one that has Spanish in him. I think he's like second generation, so then that would make me like what, like fourth generation? No, wait, no, he's first generation, so that would make me third generation. But yeah, and then the Italian part is I think third generation too. Yeah. It was weird being around some of my family members. They still speak all their languages, and I was never taught because my parents never learned themselves. They just were very Americanized from the beginning.
Your mom is Italian too?
Yeah, she's Italian. That's where I get it from.
Nice. I think my might have been great grandma. She was Italian mixed with something else. I forgot exactly what it was. But yeah, what I did notice on the paper was Haitian and Italian. It was like, oh, That's nice. I'm gonna start checking those boxes.
I think there was something from South South Africa, I think. I think it was Southern African. I don't remember exactly what it was, but on my husband's side, because his mom did like the ancestry thing, and she found out that she had, I think it was Moroccan. Yeah, I think it was Moroccan.
Oh,
Um, and she's very dark, but my husband, he's lighter skinned than everyone else in his family, so same as me.
yeah, gotcha. Damn, let's just find some random post to talk about.
Right?
Let's figure it out. Something that's not saved. Oh, Reese posted a picture.
Is it on the sub?
Yeah, it was like 6 hours ago. You remember Reese, right?
I actually personally haven't met them yet, I don't think.
It's a girl. Yeah, obviously you haven't met her when you said them.
Well, yeah, I just don't want to be I don't
Gotcha.
want to be rude. I
Let's
never
see.
know.
Let's see.
Um, let me see. I can't see it, or maybe I don't.
Oh no, I was. Oh, you're looking on. Let's go to Axe Docs. Let's see what they're asking.
Oh,
This
I
is
actually. Oh, did you get one?
Yeah, I went to Axe Docs subreddit.
Okay, go ahead.
It says my 11-month-old has COVID and she won't stop screaming. 11-month-old female, no prior medical history, born on time, all vaccines up to date. For the last 2 days, she's been vomiting, diarrhea, and sore throat. We went to the ER last night because she had a fever of 103.7. When we got to the ER, her temp didn't improve till she got some Tylenol, and they didn't, and they discharged us saying she has COVID and pretty bad ear infection. For the life of me, I cannot get her to stop screaming. She's so uncomfortable. She sounds incredibly hoarse, and she's still hot. We've been swapping between Tylenol and Motrin, and still very little improvement. The doctor prescribed amoxicillin, but only if she doesn't improve until tomorrow. We can give it to her, but this scream has been so constant. We all need to wear headphones to dampen the sound because it has not stopped for almost 24 hours. We haven't slept at all. I'm glad she still has airway, but God, it's sounding worse, and she's barely even conscious through all this. We can barely even get her to take fluids. If she does the minimal, and she's only made 2 wet diapers today. I'm not sure what else to do. We can wait it out and see what happens, but I also don't know if she's going to get any better because she keeps getting more and more lethargic, followed by insanely high pitched hoarse shrieks. Um,
Hmm. How old is the baby again?
11 months old.
11 months old. Okay. Yeah, they can't give her water yet. Um,
They can't have water.
but yeah, until they're past a year old, water doesn't process the same way that milk does.
I didn't know that.
Yeah, and there's like a whole bunch of other stuff that they tell you not to give your babies, like spinach, for example, because it has too much folate in it, and it can like overrun their systems. That's kind of crazy, but um, honestly, I'm wondering if it's not. I mean, that's a tough one because I guess it could be COVID. My husband, when he had COVID, um, I was pregnant and I didn't sleep. I was like newly pregnant. It was only like 8 weeks along, and this was with our first baby, and he had um I want to say it got up to like 106, his fever did, my husband. And I had to stay up for a week straight monitoring him because I was so scared about him getting like brain damage from the fever. And he was just like sleeping constantly, and I kept having to like get him up. I'm a tiny woman. My husband's very large. He's 6'2". So I
He's
had a
my
hard
height.
time. Yeah, I had a hard time getting him up out of bed. But
How tall are you again, you said? 5'5"?
I'm 5'1". I'm short.
Oh.
Yeah.
I know exactly how short you is. My daughter's
Yeah.
mom is 5. It's just 5.
Really.
Yeah.
It's the Mexican and Italian in me, that's for sure. A very
Uh,
short woman.
yeah, she's Cuban. Um, Cuban and Puerto Rican, actually.
Oh, really?
Yeah, but her parents were short, so.
Yeah, that makes sense. A lot of people
Yes.
in in those areas are very short.
Yeah, I know some Puerto Ricans, and I noticed that they are short, but I noticed there's one of them. He's actually pretty tall. Out of those that I do know, they're siblings, and yeah, the youngest, he's pretty tall now. He's probably like my height, maybe taller. And I was like, damn, I remember when he was little. But yeah, he grew up to
My
be really
husband just
tall.
texted me because he's right outside. He just texted me and said, "You're 4'11" because you're tiny." He doesn't believe my driver's license.
Mhm.
Oh my God. No, yeah, but he had like 105 fever for like a week straight, and I had to be like super on top of his medications, and I was trying to do it the right way, but it wasn't until the third time that I took us to the hospital, to the ER, because they kept pushing us away. This was back in 2020 when COVID became like huge. And everyone was under curfew and stuff. Um, and we went there again, and I told them like his fever is not going down. He passed out twice while we were there, and it was really bad. Both of our blood pressures were super low. And his is like, I mean, he's a big guy, so it's dangerous for his blood pressure to go to as low as for someone like me. 90/50 is not bad, but for him, it's pretty bad. So COVID can be gnarly with the fevers, and it takes forever to get them to stop. But the screaming is most likely from the ear infection because it's probably worse than what they said. And honestly, they should probably be treating it while they're, doing at-home care for the COVID. But I just don't understand why they gave her the amoxicillin, but then told her not to give it to her until like more time has passed. But if she's in that bad a shape, I don't feel like that's safe because the ear infection could just get more. It could get worse. And
Right.
then at that point, you need more something stronger than just amoxicillin.
Yeah, you know more about babies than I do. Um,
I also know about rotavirus, which is the other thing that I was gonna say. The rotavirus is like basically children's stomach flu, and it's really gnarly, but it really only affects children. Like my kids had it when my little girl was young, and she was like still like a baby. But me and my husband, they had it for like a week, and it was so bad. And me and my husband never got it. I guess some parents do and some parents don't. And we never got the vaccines for it as kids, so I don't know why we didn't, but I think both of our moms said that we probably had it quite a few times when we were kids. It's like a immune thing. Like once you have been um exposed to it enough times, you start to not experience any side effects from it. But that shit is super gnarly too. And my daughter got 105 fever with that.
yeah, it's like roasting your brain.
Yeah.
Oop. Yeah, let's go to the comments. Man, 105, I couldn't imagine.
Yeah, it's scary when it
I'd
gets to
have a
that point.
seizure. Yeah, she's a warrior. She didn't have a seizure. But
Yeah.
man. One of the comments is, maybe I'm misreading, but did they say to not give her the antibiotics until tomorrow if she doesn't get better? But due to the decreased oral intake and urine output, she probably needs to be seen again, especially if she is still vomiting and diarrhea. The other person's response was, yes, the resident told us to pick up the amoxicillin from the pharmacy, but not to give it to her until 48 hours with no improvement. The only improvement is her fever has gone down, but she won't take in any fluids, which is starting to concern me.
Yeah, for that long, that is definitely concerning. I think at that point they do say that it's okay to start supplementing with something like Pedialyte, which is made specifically for kids. Um, and that stuff can really get the dehydration gone fast.
Another comment says, that sounds like it warrants another trip back to the emergency department, unfortunately.
Maybe
So,
not to the same place either.
maybe not the same place. Yeah, I feel you there.
I'm gonna mute myself because I'm about to blow my nose out. God, that stuff screws with my nose so bad.
I gotta say this one because it's funny. It says bad breath and throat feeling after deep oral. Hi, I'm a 19-year-old female. A few weeks ago, I gave my partner oral sex and it was kind of like deep throat. A few days later, I started noticing blood mixed with phlegm coming from my throat a few times a day. It lasted about a week and a half, but blood has stopped now, but there's still phlegm. What's lingering is the weird feeling like something stuck in my throat, and my breath smells bad even after brushing and using mouthwash. Could this be related to
Oh
tonsil
God.
stones or throat irritation from oral? Is it something I should just get checked out? There's no sore throat or fever, just that stuck feeling and bad smell. Thanks in advance for the advice. I don't know what to tell you about that one.
That sounds like an STD, honestly.
You
Oh
need to get that
God.
checked out as
Yeah.
soon as
And also
possible.
make sure that your partner isn't doing something on the side.
Right. And balance in your throat.
Oh my God.
Okay, so, 23-year-old male, hurt myself using a fleshlight and fear that is worse than my original thought. Pictures included. What is a fleshlight?
You don't know what that is?
I'm I'm sorry I asked that. Maybe I'm sorry I asked a little bit.
I
Um,
don't know if it's something we want to explain on here. It is
I'm gonna read it. So
it's a product. Yeah.
it's like the pocket thing, right?
Yeah, basically.
Okay. So I'm gonna read it. It says I'm 6'1", 170 pounds, from Morocco, but lived in the US. I don't drink, smoke, or use recreational drugs or take any medication. Here are some pictures of my injured penis. Oh man, I'm not clicking that.
Oh, please don't. You'll be
So
traumatized.
it says, so context. I initially hurt myself masturbating because I was doing death grip with insane speed, leading to an ashy penis. I took away from masturbating and was able to get boners and sensation again, but visually it wasn't fully healed. Well, then I used a fleshlight and zoned out for too long without relubing it, leading to a sandpaper effect, and it hurt. Additionally, I had dropped the case, so I got scratched a few times with the fleshlight, refusing to stay in place. I foolishly continued to masturbate for a while, but I've stopped over a month ago. Still, I can't really see the visual improvements. I get morning wood briefly, but other than that, I can't get boners. My testosterone levels are fine. I'm at around 19% body fat, so not lower than your high enough to cause problems. It is entirely from the injury, and I fear that I may have caused some nerve damage. I have an appointment with the urologist, but there's 2 month wait. My insurance doesn't give me many options. Is there anything I can do in the meantime? I'm wondering if washing my penis prevents me from healing. I wear boxer briefs and was wondering if I walked around the apartment bottomless, if it would help the healing process. I live alone. Any help would be appreciated.
Wait, did they not wash it every day? I kind of figured that that was just like common knowledge that you need to do that.
Yeah, I think he said, I'm wondering if washing it prevents from healing.
I would say that that probably helps because if you leave it unwashed, then there's more likely cause for an infection.
Right.
And it sounds like they severely damaged something for sure.
Mm. The comment says, if you're still having dry skin, then an unscented lotion or a thin layer of Vaseline might help. Don't use any, don't see any obvious problems with your penis other than possibly dry skin, healing abrasions. I suspect the trouble with erections could be anxiety, but the urologist should still be able to give you better answers. In short, apply lotion, use lube when you masturbate, avoid death grip, and see your urologist.
I want to ask, but at the same time, I don't want to ask what that means.
Uh, yeah, that's like you fighting with it.
That doesn't sound safe.
It isn't. I mean, I haven't been through that personally, but I've heard about it a few times. Yeah,
They
yeah,
got some interesting posts going on there.
yeah. This is the Axe Docs subreddit. So I'm just going through this. This says mom, 59-year-old female, was extubated and left to die for almost in half an hour. What was it like for her? I'm looking for real answers, not comfort or sugarcoating. Mom was in a vent for almost 2 weeks because of an interstitial lung disease, a delayed reaction to her chemo for cancer, which was fucking beat, which she fucking beat, but we can unpack that later. She was on a vent for 100% of oxygen and the highest safe pressure. So eventually they said, we need to either leave her on the vent and risk her lungs popping, scarring was rapidly increasing, or start comfort care. They described it as putting her into a deep sleep or at least a deep delirium and her extubating her. Peaceful is how they described it. When we, her children, opted for comfort care, they started very slowly upping the fentanyl. Eventually, they just came in and asked if we were ready to excubate. She was still fully conscious. They talked about hearing her voice after they took the tubes out and made it seem like excubation was the immediate step, but extubation?
Yeah, extubation, taking out
Extubation.
the tube.
So I was saying it right.
Yeah.
Nice. Okay. It said They talked about hearing her voice after took the tubes out and made it seem like the excubation was an immediate step, but she would eventually die. My stepsister and ICU nurse asked if they would put an oxygen mask on her. Everyone's interpretation was yes. We gave the okay. They took the tubes out and she never spoke again. They took the tubes out and she never spoke. She immediately turned blue. She grabbed us and stared at us in fear. It took her 25 minutes to die. They never gave her oxygen. She just suffocated in front of us. Was it like drowning? Was she scared at first but unconscious within a few minutes? Or was she there with us suffering for almost an hour and a half? I need answers, an honest one, so I can bring full truth to my therapist and start to get through this. I can't sleep. Thanks in advance for your honesty.
Man, that is a rough one.
Yeah, I don't know what you went through. I am so sorry. And 59 is pretty young. Um, yeah, I mean, grandmas are getting way younger these days.
They are, yeah.
59. I don't even
That
think.
would be traumatizing for sure. Just like, I mean, like I can understand why they probably wanted to ask that question because I mean, watching your family member come off a tube, being told by all these doctors that she's gonna be able to talk again and everything will be okay, and then the next thing you know, she's gone. Like,
Right,
I feel like they could have probably prepared them for that better than just being like, oh, she's gonna be fine, and then rushing them into it.
right. That's messed up. She said, was it like drowning? Uh, Was she scared at first but unconscious within a few minutes? I don't know. Yeah, I've never been through that, and I pray I do not have to go through it. But let's go through a comment. It says, to be honest, the honest answer is that I don't know. If she don't make any effort to speak, there is a very good chance that she was not aware of anything that was going on. If she was, I think it probably passed quickly. I will tell you what I do know. I know that many families make different choice. They want everything done for a patient who is mentally gone already. I know that everyone who works in an ER or ICU says, please don't let that happen to me. Please, when it is my time, let me go. Another comment says, I'm sorry you had to go through such a horrible illness. I can't give an answer with 100% certainty, but if she never spoke and only took 25 minutes to die, I suspect I suspect she wasn't aware of what was happening. The oxygen mask, this is hard. I suppose there was no way she could survive. So giving supplemental oxygen would have been inadequate and would have prolonged her quantity of life without any quality. I don't think she suffered. I don't think that you as a family made a very hard choice, and it was absolutely the correct one. You let your mom die with dignity, surrounded by family, which in these days is very rare. Your mom would be so proud and thankful of your strength and compassion.
That was a very sweet comment.
Yeah, it wasn't all the way. That was the one of the last comments. Oh, one more. It says putting O2 on that scenario isn't advisable as it had prolonged the suffering. It would have been beneficial in any way she received meds that would have relieved breathlessness. It is also a lot more comfortable not to wear the O2 mask. Remember, it was the lung fibrosis that was the culprit. We very rarely ventilate patients with it in the UK as outcomes are very poor. It is mostly buying time to say goodbye. So sorry for your loss. I hope you can heal and recover. The person responded, "Thank you. I do think it largely just brought us some more days with her, as you said. I really appreciate your insights." People are getting good answers on this page.
I posted on there one time. I never got a response.
I got another one. It says 28-year-old female on oxycodone 15 milligrams, sumadatropin 50 milligrams, Claritin, Zyrtec, and Benadryl. Medical history is 13 VP shunt revisions, 2 back surgeries, bum right leg, and irrelevant but annoying, a shattered kneecap, and femur wood floors hurt. I am once again in VP shunt failure. Insurance is demanding the nuclear dye test despite 2 highly elevated lumbar punctures. But because I wound up with a shunt from the head injury, imaging looks fine. They declined the nuclear dye test they demanded because they want an MRI. I have a PSTD from the injury and anesthetic, so I can make it through without a panic attack. My poor surgeon's office is trying to get either of the 2 tests approved. And last night, one of the worst migraines I've ever had hit on top of the pain from shunt failure. I can handle either shunt failure or migraine. I can't take both at once. I asked insurance if I ripped the shunt out of my head, if they'd be forced to fix it out of frustration. But with how much pain I'm in and them not being willing to fix it, I'm now in desperate to get this fixed. I don't want to hurt myself. I don't want to actually rip it from my head, but the hospital won't do anything because I have every sign of overshunting, slit like ventricles, no papilledema, etc. The only reason my surgeon believed me when this happened last time is had an MRI from before the shunt was ever placed, and it showed the same thing. The slit went ventricles were always there. He knows we can't go off imaging, but the ER will tell me it looks like shunt's working and follow up with your surgeon outpatient. I seriously don't know how much longer I can handle this pain, and I need to know how to make it stop. There is no comments, but I do not suggest ripping shunts out of your head. I don't even know exactly what that looks like. I know what stents are, but shunts, I haven't heard of that one.
I wonder if the migraines, like, cause I have sumatriptan. They gave it to me because I was having the right side head pain in April really severely right before my status. Um, and they gave it to me in the hospital because they were like, "Oh, you have migraines." And I was like, "Well, what about the seizures?" And they were like, "Well, you have migraines, so let's just deal with that." And I was like, "Okay." I never took it. Um, and I argued with the doctors and I told them I'm not leaving here until you give me something that is going to help me with the seizures. And they could not say themselves, even though I had a clear EEG while I was there, that it was not um, epileptic. They said it was inconclusive. So, and now with my new neuro, he knows what he saw, what they saw was not caused by the medications that I was on while I was in the hospital because I wasn't on those anymore. But if the sumatriptan is not helping, then I don't understand because sumatriptan is strong. It's a strong migraine medication. It's like I think it's stronger than Excedrin because Excedrin you can get over the counter, but sumatriptan is only by prescription. So if that's not helping with the pain, then it has to be something internally. And so that doesn't make any sense why they're telling this person no. Like, just go follow up. What is a surgeon supposed to do without someone else backing him up? He can't just go in there without approval.
Like,
That's a shitty situation to be in. That they're just like completely ignoring what this person is saying.
yeah. So I looked up shunt. So the shunt is a hollow tube surgically placed in the brain or spine to help drain cerebral spinal fluid and redirect it to another location in the body for reabsorption. General definition: the term shunt means turn off to one side or shift. Yeah,
What is overshunting? Excessive drainage of CSF from the brain ventricles or spinal canal.
yeah, that's a
Jeez.
lot. Uh, believe it when we say people have it so much worse. Um,
Yeah.
someone I was talking to, he was like, I don't feel like I should be ranting. He was like, people have it so much worse. I feel like if you have epilepsy, you have the right to rant about whatever you want to rant about. Regardless of what you have, you can rant. Don't let anyone tell you you can't rant, especially if you have something you need to get off your chest about something you're dealing with and not them.
And
Um,
you gotta have support no matter what you're dealing with.
right. Um,
But it is good to remember that it could be worse.
right. So it says 14-year-old male has painful ingrown toenail. My son, 14-year-old male, around 5'5", about 170 to 165-ish in weight, has ADHD and anxiety. He takes antidepressants, ADHD seasonal allergy medication, and does not smoke. He has no other concern other than the nail. He often has ingrown toenails but stops them when they are mild. He had forgotten to clip one of his nails, and I was wondering if I should take him to the podiatrist because he says it hurts pretty bad. Hurts to put pressure on the right side and his big left toe. And he maybe had some pus come out. He also tried to clip some away, but only got some. There is one piece of the toenail still digging into his skin he can't get to. I will post pictures in the comments. Mm.
Yeah, take him in. Like immediately, because sometimes that can happen and people can get their toes removed. He's only 14, he doesn't need that.
I want to see the picture.
Oh God. Don't show me.
I can't find it, luckily.
My cousin had an ingrown.
Oh, I found it.
Oh God. My cousin had that. He had to get surgery on it.
No, it's not that bad. Look at that. That's not that bad. Well, it hurts, so it doesn't look that bad, is what I should
It
say.
looks a little swollen, but also I don't know how his other toe looks. Okay, that's pretty swollen. But his other toes look swollen too, so I can't tell.
Yeah, that looks it looks pretty bad, but um, yeah, I haven't had an ingrown toenail, but I do suggest taking them in, especially if there's pus coming out. Once something gets that bad, I'm seeing pus, especially if it's on my toe. I'm going to the emergency room. Um,
Yeah, you don't mess
yeah,
around with that.
pus in my foot is not somewhere I want to have it, especially if it's not a scar or something. Just ingrown toenail, something is wrong, and take him in, especially if he's bothered by it. Take him in before he has to go to school in the morning and walk on it.
Yeah,
Um,
my grandma had, or not my grandma, but my husband's grandma. My husband's grandma had an issue with that. She has diabetes and there's something wrong with her leg where it only has one main vein to like the blood supply isn't enough to the whole leg. And she had to get her toe removed, and it started with that because it wasn't healing, because she tried to do it herself, and then it got so much worse like so fast, and she ended up having to get it removed. That is not a fun situation to be in.
Mm. So I'm gonna go read this first comment. It says, I've gotten NAD, but I've gotten them my entire life. We got to figure out what NAD means.
It means not a doctor on that sub.
Oh, not a doctor, but I've gotten them my entire life. A podiatrist was life changing for me. They clipped the entire side of the affected toenail. It was infected too, and it now rarely happens. It used to happen constantly until then. Please take him in to one. Don't try to clip on it on your own at home. It'll just get even worse and possibly infected if you cut too deep and break the skin. The procedure was like 1 minute long and was painful for all of a few seconds. I was numbed and he extracted it super quick, and that was it. Walked out of there with a fixed toe and no more reoccurring ingrowns.
Those ain't nothing to play with, man.
Someone else says, same here. I had one I had one side on each toe, but currently have one on one side that's not done. So I will likely try to get it done. One of my kiddos gets them pretty frequently, but of anxiety picking. Recommended seeing preferably a podiatrist or a dermatologist if you can't find a podiatrist in your area. The reason I say is that because the closest podiatrist that accepts my insurance is about 2.5 hours away, but a dermatologist is only 40 minutes away in my case. Yeah, someone else is not a doctor, the toe, trying to find the nail rather than cutting with clippers and push the entire cuticle away from the nail. Using a file will make it less likely to catch on to stuff, less able to pick that, etc. Will hurt when doing it, but relieves the pain. My son says it feels much better, same age as your son. It doesn't look infected at this point, but it starts to get red, if it starts to get red, hot, pus, he runs a fever, etc., medical treatment is required more emergently. Mm. Let's see. It says, how bad is smoking weed for people with BPI1 and schizophrenia? What's BPI1? We got to figure out before we read this criteria.
Bipolar stage 1.
Oh, okay. Well, there you go. You know stuff I
Yeah.
don't know.
Yeah.
That's why we're great together. Hold on. How bad is smoking weed for people with BP1 and schizophrenia? I have two siblings that have been diagnosed with schizophrenia and BP1. They generally function pretty poorly. They both smoke, although they say they don't. They say they don't do it that often. One smokes large quantities when they do. I have heard that it is dangerous for people with these diagnoses to smoke weed. I have relayed this to them, but one thinks the damage has already been done, and the other is convinced it's a natural thing, so it's good. The former recently was taken off their antipsychotic, but their prescriber and started a stimulant medication, so I'm worried. I smoked with them and they both outdid me. How bad is this? I can communicate the risk to them. Female, 23 years old. Um,
um, do you have parents?
oh,
That's
right.
that was what I would start with that. But I mean, I had that. I didn't have stage 1, but I was diagnosed BP stage 2 when I was 17. I mean, I smoked weed with that, but I mean, stimulants and downers never did the right things for me. It was like opposite effect. So like I used to smoke cigarettes and that would always make me feel tired and hungry. And then when I would smoke weed, it would make me feel super wired and have zero appetite. Um, which is weird. But I stopped doing it just because I don't like it anymore, and it messes with my like physical symptoms from my conditions. Um, for schizophrenia, I don't think that would be safe because you can, if you're smoking a lot, then I mean you can get like some pretty crazy hallucinations. My sister did it one time. We were younger, and I remember her, I don't know if she was faking it or not, but I remember her freaking out. She started sobbing, screaming at me and my sister, saying that the drawers were talking to her, and that it was like this whole thing. It was crazy. But those were edibles, so I guess those are kind of a little bit stronger technically. I don't know. I'm not like super informed on that stuff.
Crazy.
Yeah. But I wouldn't say that that's safe for the person with schizophrenia. But with bipolar, I don't think that's very much of an issue because when you're manic, a downer would actually probably help.
Yeah. I don't know much about bipolar, but I'm going to go through these, or schizophrenia. I'm going to go through these comments because there's quite a few. The first comment says, can induce psychosis. The response to that says, not a doctor. Popular Canadian public radio show hosted by an ER doctor, Dr. Brian Goldman, has an episode on this exact topic, marijuana and psychosis for people predisposed to specific mental health conditions, discusses science and risk for the population specific for that population specifically. That's very interesting. Let's go to the next comment. It says it's like one of the most preventable worst things you can do with the condition. Almost every kid I see has early psychotic conditions, has smoked a ton of weed. It's both a risk factor for each development of schizophrenia and a risk factor for future psychotic episodes. I would not say there's any safe amount to consume as far as I'm aware.
And if they're out smoking you as a 23-year-old, I'd say that they're smoking a hell of a lot more than not that often.
Right. The response to that was, does having psychotic episodes related to weed indicate anything? Can it happen to people without these disorders? The response to that was, yes, if people experience psychosis while using marijuana, they are at a higher risk of developing psychotic disorders. Sources say. Okay. Rapid increase in bruising and bleeding. Recent ER visit the next day. Referral to hematology and oncology. 31-year-old female, 10 milligrams Lexapro and 10 milligrams Adderall daily. Asthma, no other known diagnosis conditions. 5'5", 158 pounds. About a week ago, I noticed new bruising without apparent trauma. I've been having intermittent clots, spotting, mucus discharge vaginally and rectally. I went to the OBGYN regarding the bleeding, and when I showed him the bruises, he urged me to be seen that evening for hematology consult. I went to the ER, and the attending took pictures of the bruises and consulted hematology. The labs have been on a downward trend for about 4 to 6 weeks. I can attach labs if that helps and if it is warranted. Hematology got me in Monday at 8 a.m. after calling them per the ER discharge paperwork. I just noticed that I have broken vessels and new bruising in the area where I was wearing spandex compression shorts last night. I have been short of breath most of the day, but attributed to overexerting myself with little sleep last night. I will attach some photos below, but between the urgent referral to hematology oncology and the rapid progression of bruising, I'm becoming concerned this may be something which is progressing much more rapidly than I thought. Pics below. Is there anything I should be looking for that would warrant a check-in before Monday morning? It's Friday evening right now. Thanks in advance. For clarity, also to add to my BP during triage was 166 over 108. I've never experienced a reading that high in my life. I'm a steady 120 over 80 or lower, if anything. Just trying to think of anything abnormal relevant. I apologize. They're talking about blood pressure. Oh yeah, BP.
Yeah.
66 over 108. Is that bad?
I mean, that's pretty bad. That's like what, like hypertension stage 1 or something, or stage 2, I'm not sure. Um, but yeah, that's pretty bad. And if she's sounds like she's a small girl.
That's the bruising right there. That's what she
Oof.
wanted to go to the ER for.
Yeah, that's understandable. I have gotten that before myself, and it was because of I don't think I have any new bruising right now, but I
Yeah,
still
I don't
get
get any.
bruises to this day.
When I
But
get
it
random
was,
scratches like this, I go to the ER.
yeah, 'cause that's like what's the word for that? P Purpura or something like that, like broken capillaries in the skin, under the skin. Um, so yeah, that sounds pretty intense. I had bruising on my legs before my diagnosis of endoendoadeno. It turns out that I have pelvic congestion syndrome, which is like overgrowth of veins surrounding the uterus. Um, and I hemorrhaged severely after that surgery that I had, to the point where um, I almost had a blood transfusion. And and also I found out I had a seizure on the surgery table and they never told me about it. So that
How'd you
was
find
my,
out?
yeah, it was crazy to find out, but
How did you find out?
well, so they sent me a fax that was supposed to be sent to the hospital, and it was completely by accident because it literally said on the paper, do not read this if you are not the referring physician or whatever. Um, but I saved it, of course, before they deleted it. I was so on top of my stuff back then that anytime something new got pulled up, I would just go straight there and save it. And I saved it. It turns out they called my anesthesiologist 3 times back into the operating room. They had me on oxygen, extra oxygen than they already had me on. Um, and they called him in because my systolic and diastolic blood pressure went crazy high, like super crazy high. Um, and they said that part of it was because I had a seizure on the table. I don't know how long it lasted. They didn't put any information about what kind of seizure it was. Um, but yeah, once I found that out, I was like, holy shit. So it did happen before, and they just didn't tell me about it. Um, but yeah, bruising on your legs is it can be a sign of anemia, but when it's that severe, um, that's a sign of blood leakage, and that could be an issue with your veins, that could be an issue with your pelvic organs, that could be, I mean, that can even happen with like ovarian cancer, uterine cancer, cervical cancer.
You want to see some pictures?
Sure.
Yeah, because I was just waiting for you to be done talking, but yeah, they get worse. There's that one.
Oh my God, dude.
Yeah, I think that's on the leg. I think that's a leg.
It looks like a leg, maybe.
Yeah, it looks like a leg. Inner leg. Right below, I mean, right to the right of the knee, it looks like.
Well, and she also talked about there being clots coming out vaginally.
Yeah, she doesn't have a picture of that. Unfortunately, no, I'm playing. um, I don't exactly know what any of that means. Do you know any of that means? Hold
I
on.
can't see the words.
Yeah, it's the camera. No matter how good iPhone is.
What does it say on the one that's yellow? The name of it, the test.
MCH.
MCH. Yeah, so that's your that is part of your CBC. MCH is part of your red blood cell count, mean corpuscular hemoglobin, which is basically a sign your hemoglobin goes lower if you're hemorrhaging large amounts of blood.
Music.
It's back.
Hi, Kate.
Okay, so here is bumfuck nowhere. We passed some fox, some deer, some possums with a baby on her back, and this is what Jamar's doing to stay awake. Oh, you'll see. He was headbanging like 2 seconds ago.
Oh my
He is not feeling this place. This place, look at what this looks like. We are strict insomniacs tonight, right? We don't have to be all epilepsy talk. Look at this
Oh
shit.
yeah,
This
this
is
is for
one big
anything and
like.
everything.
Room.
Oh my
Okay,
I'm on
God.
yeah, that's this place is just one big open room. There's a bathroom. There's a bed. One bedroom. Come on,
Oh
Jamar,
my
that was not an indication. Whatever.
You
But
know, kids with road trips, they do
That
not
looks
like to sleep.
nice. That looks like a nice
no, I mean,
cabin.
it was nice for a fucking party spot for like honeymoon getaway type shit. But yeah, and with the family, takes some getting used to.
I would imagine so, yeah.
Is it hardwood throughout?
Everything got a total like pine oak, whatever this is, smell, cabin feel. Yeah, it's legit. It's legit. And there was no driveway. Road was
Oh
paved
my
up
God.
still. One little, I don't know, felt like a 2-foot drop off the road coming down this little dirt path. And we made it up to the front door, but no clue how she's gonna back out or pull a U-turn or something. I don't know. But we'll see. When the sun comes up, it might be easier.
Or yeah, that is
Hopefully we'll
NARS.
go to sleep before then.
Oh my gosh.
Hey,
Okay.
this is the place that Sailor Moon recommended.
Look at this picture. This is the right medial distal femur.
Wait, can I share? Yeah, I can share pictures on here, right? Let me show
Yeah.
y'all something.
Okay.
Let me see. How do I change from recent?
That 6-hour drive would not have gone by half as fast without the meeting. So thank you for keeping it going, Pookie.
Yeah, yeah. I got insomnia, so keep this going.
Yeah, watching the streetlights would not have passed the time.
We've come across some funny ones and some wild stuff. Some throats hurting because of oral. 2 weeks later, we've come across some stuff.
All right.
The fun part. Okay, here, let me show you. I'm gonna show you guys a couple of pictures. And please excuse my oh, I don't give a shit. Whatever. Here, okay,
No
I'm gonna,
political correctness after hours. You get
yeah.
it.
Okay, so here's one. And then I'm gonna send another that is even worse than that one, because that one's like mild compared to this one. Where is it this one? I think it's this one.
Okay, now I see it.
This is from when I was bleeding into my legs.
So these came up totally unprovoked.
Unprovoked, yeah.
Okay.
And this
And it
is
looks
just a
like the
couple.
other girl.
I got a whole album of full of those, but that was before my diagnosis of endo and adeno. But like I was saying, those ones are far more severe. That could be a sign of like some type of cancer, which is why she could have been um referred to oncology. Because ovarian cancer, which is what they tested me for, ovarian, uterine, and cervical, um, those ones for me were a little bit higher than normal, but they said that that was fine still. I don't know what that meant, but
I
I
would want
never
an
got a
exact
referral.
number on that one.
Wait, what?
I would request a specific number on that one. What's the range and where do I fall?
Well, yeah, so I was able to look at like reference ranges and mine was higher than normal, but their averages within their specific hospital that I was at, they said that it was
Sure.
within normal limits. So I still don't know about that, but yeah, that can be a sign of female cancers. And with how severe her pictures are, I would say that that would probably make a lot more sense.
Yeah, so I got one here. It says, I'm 6 months postpartum. What does that mean? That means like you already gave
It
a
means
baby?
post birth, basically. So your baby's 6 months old.
Oh, oh, okay. It says, I am 6 months postpartum and I found out I am 3 weeks pregnant today. I am considering terminating, but I have a couple concerns and really need some advice. Possible TW, but unsure. Talk of pregnancy and abortion. 33 years old, 33-year-old female, 180 pounds, multiple C-sections, and most recently was December 24th. History of gastrointestinal diabetes, uh, gestinal gastric diabetes times two, and preeclampsia every pregnancy. I found out I am 3 weeks pregnant today. This was unplanned, and I'm freaking out because we simply cannot afford another kid, and I truly don't think my body can handle another pregnancy. Since I have had multiple C-sections, I do need to reach out to my OB, or can I just order the abortion pills and terminate the pregnancy online? I live in Florida and I am worried about possible issues coming up by telling the OBGYN. I trust her and I feel guilty forever for even thinking about not being honest with her. But laws in Florida are such a gray area right now. How high of a risk of complications do I have due to my history? I am only 3 weeks and I am very much pro choice, but have never terminated a pregnancy before, and I'm super scared. Would be thankful for any insight.
That is very understandable why she's scared. Preeclampsia, preeclampsia is no joke. Um, and it doesn't sound like she has very good comorbidities either. Those could pose a problem. Um, I don't know much about the laws over there. Kate, would you have any better idea on those?
They definitely need to determine a mortal, whatever the word is for like, this pregnancy could kill you, like mortal risk or something, in order to uh, legally abort terminate the pregnancy. The pills
Okay.
are kind of a gray area because they're just not as effective. And to get it
Yeah.
done at one of the clinics, like the right way, basically,
you have to establish and get a doctor to sign off on this pregnancy being a threat to the mother's life.
I mean, is it an option for her? I mean, she said that she trusts her OB,
Did she
but
say how far along she was?
she said 3 weeks.
So it sounds like she's still within. I think they go to 12.
Well, then, yeah, I would say she should probably talk to her OB immediately because
Absolutely.
getting the pills online, I don't know what she means by that, but
That's such a risk of just like a Downs or a cleft palate or like
yeah.
horrible implications for the child.
And then probably also too for herself.
Exactly. If she's already had so much trouble,
Yeah, that's dangerous. She's definitely got to go through her
that is
OB
a
for
threat to
that.
her life. Yeah.
Yeah. And if her OB has issues with it, then she needs to come in with a paper listing all of
That's
the
when she
issues that
has to
they've
go to
told
the
her.
clinic.
Yeah. That way
Yeah,
that
that's
they
when she'll
can
have
have
to
all
go
the
there.
info.
And then she would have to still just come up with transportation. I mean, those clinics are. I mean, that's the places where people hang out and just talk shit and like throw shit at girls walking in and out, and they do that all over the place. So that's stressful in itself. But
Yeah.
that would be the only plan B
Hmm.
if the OB isn't on board. And that's another thing with a lot of OBs down here in the not private ones where you can go with Medicare and Medicaid. A lot of them are like outspoken, like anti-choice.
Yeah, I mean, I wonder, like, I know it would be far more difficult with kids, but I do know that there are some women out there, in other states where it's still, not as regulated that offer to help in those situations. So maybe that would also
There are
be,
programs, yes.
yeah, like an option too as well.
Yeah, dig into something else. Oh, okay, that has to do with epilepsy. We can find something else. I don't even understand that word. We can go to something else. Oh, okay. Anxiousness help. This paragraph is mostly my story and extra info. I'm seeking advice in the second paragraph, and you'd like to skip? If you'd like to skip. Okay, so 15-year-old female. I turned 16 in less than a month. Struggle a bit with anxiety. I do not have diagnosed anxiety, nor do I diagnose myself with it. When I say I struggle with it, I mean that it feels like it owns me, especially when it comes to anyone driving. There are things I feel like I miss out on due to my anxious thoughts, like sneaking out. I know I shouldn't be doing that. My friends invite me to the Waffle House at like 3 a.m., and I really, really want to go, but I can't. My friends get mad at me for being anxious. I cannot bring myself to get in the car with her and drive with her, even though she is licensed. It's the same with anyone else. One time I had to drive with my sister's boyfriend, 25-year-old male, and it was awful. I was battling myself in my mind because I didn't want him and my sister to know I was being anxious. I also didn't want to look like a backseat driver. I pinched and scratched at my arm to try and relieve some of the anxiousness I was feeling, and my arm was bright red in some spots because of it. Anyway, I want to not miss out on these things. I don't want to miss out on driving with my friends just because I'm so terrified. It's not just with driving either. That's just the worst of it. It's the same with carnival rides. Common, I know. And even sitting in school, I start to imagine all the things that could happen and try and plan ways to get out of the situations in case they do happen. One time at work, I almost passed out during a semi stressful interaction. I have passed out before, so I do know how it feels to do so. To sum it up, I'm 15-year-old male, turning 16 in a few weeks, 96 pounds. Want to know if there's anything I can do about my undiagnosed anxiety. And no, talking to my parents is not an option. They are super religious and just tell me, pray it away, that getting medicated will never happen, and are so over the counter meds are there any over the counter meds I could take? If so, how much and what is it? Any tips to help me? Breathing does not work for me unless I'm in a situation like I'm short of breath. Please, someone help me. I hate this so much.
That is a really hard situation to be in.
Absolutely. That boy has nobody.
Yeah, I mean,
Actually, a female.
Oh, girl.
Yeah, and her parents don't want her to take medication for it, so she's just like,
Stuck.
it
yeah.
sounds to me like she could, I'm not a doctor, but she could possibly have like OCD, catastrophic thinking, probably because of what's been put on her from her parents.
For her
Um,
whole life projected on her.
so yeah, like these things that she thinks are inherently bad things to do, she's so scared to do them and thinks that that's her fault, despite the fact that it's not. So, yeah, she needs some support, man.
Yeah, desperately. Somebody probably, I mean, to be so quick to say that breathing doesn't work, so nobody's probably ever taught her to do it right.
Yeah, and
And
videos
what
online
you
never
think while
help
you're doing
either.
it, no, until you see it, because you can hear it, and
Hmm.
yeah, it looks very different in person. That would be like doing physical therapy through a video.
I
It's
mean,
not.
like, you can't be against therapy. I mean, therapy is something like maybe okay, a psychiatrist, like maybe her parents will freak out about a psychiatrist because yeah, she said that they're scared about the medications, but a therapist at the very least could help her understand that this isn't her fault. Give her somebody to talk to. Like
Yeah,
that's just
that's what
like,
it
oh my
is.
God.
This is exactly one of those situations where the child is not in such pressing danger that a wellness check would result in any action, but
Hmm.
she definitely is going without desperately needed support, and
If
it
she goes
could
to like
lead to
school,
the
she
worst.
could possibly talk to like a school counselor or a therapist. I did this when I was 16.
Okay.
Um, and I did it behind my mother's back, which
Mhm.
led to my father, who was more supportive of me, um, coming into the situation, calling a welfare check, and getting me out of there. Um, and the counselor was so good at it. She was able to do it all under the guise of something completely different and was able to do it cleanly. So that is a possibility, like just like, you can kind of like ease your way into it, ask what you can talk to them about, what they're available for, and if they would have to tell your parents, you don't have to tell them anything right off the bat. Um, and then like if your parents do get told like, oh, she came asking to see if we would talk to you or not, then you could just tell them like something made up, like, oh, I was just gonna ask about like a sport or something,
Mhm.
um, or making a club. You can make something up, but like keep it hidden until you know for sure that they will actually help you, and then maybe they could end up doing something for you.
Yeah, that's a better way to do it.
Yeah.
So it is midnight and I feel like painting.
You're gonna watch
All
some
right,
pop
all right.
rocks.
Um, I'm just saying, sometimes things come to mind and I'm looking at this paintbrush like, why not just grab the paint? But
All right. Never pass up the opportunity.
Right?
Want to let me and see it keep talking?
no, I got
Oh, pick
something
it up.
here.
Oh, okay.
It says, scared I will never have sex again. Friend of a tear, not healing. 20-year-old male. About 7 months ago, I tore my penile frenulum. I had sex whilst it was tore, which made it even worse. And now I'm at a point where I'm scared it will never heal the same again. I haven't had sex for over 10 weeks, and now the tears have not sealed. They were not particularly deep, no bleeding at all. I'm afraid that because it's taken this long, even when they do heal, they will be weak in structure and they will re-tear. The first and only comment
Ouch.
says,
I didn't realize what that is.
It's a tear in the skin. I forget what part the
penile frenulum. Let me look
It's
that
the
up.
thin band of tissue connecting the foreskin to the underside. The
Yeah.
underside is called the frenulum, and they call it
And
a
what's
string tear.
crazy is that it can bleed so much.
That's where all the blood flows.
Yeah.
Yeah.
It could like stop and then it could start and then just like it never seems to stop. It is scary.
I don't know
I
why
was
that makes me touch myself, like figure out where this frenulum is, but it like
It's okay. We probably do the same thing.
no, I was
Yeah.
like, what? But yeah, I gotta look up frenulum instead
I
of
think
feeling
it
out for it.
happens I think it can happen to people who had like botched ones still. But I think it happens most often to ones that already have it and without being cut.
So it could one of the causes is where somebody who just has a naturally short frenulum, so it's more
Mhm.
prone to tearing because it's just more thin right there. Oh, caught in a
Yeah.
zipper, that can do it.
Ooh,
Oh
yeah.
God.
But the
I
most
watched
common
that one
cause,
movie.
the most common cause they're saying is vigorous or rough sex.
Oh man,
Hmm.
one pops up. This is not in my history, but a bunch of penis just
Are we
popped
gonna
up.
give you nightmares today?
No, but I'm just looking at these tears, like, what the hell, man?
Yeah, they're gnarly. I've
And
heard a
if
couple
he
stories
went
about
back
them.
at it with like before it was healed, worst thing.
Yeah, that just makes it far
That's,
worse.
I mean, besides taking longer to heal, like risk of infection now, come on.
Well,
Yeah,
and then also too, like
Not
you
worth
could do
it.
more tearing, more damage.
Oh, yeah.
there's one guy, and it's like a tear from the tip to here, and I'm like, shit.
And Pokey, you see how they can go deeper?
Oh
Some of them are
man,
like surface. The one, ooh, depending on the position and probably how far and how long the damage was done, that tear could actually have gotten deeper rather than longer.
He needs to go see a doctor.
oh yeah,
Desperate.
you should get that fixed.
ER
Like
right
I don't
now.
know if they could like do surgery or whatnot, but they might have to at this point
Well,
if
they
he
might
did
have to
it
do
while
stitches.
they were there.
That's for sure.
Yeah.
Let me see what they say. How you get it fixed?
Oh, they have something called a frenuloplasty. It's a surgical procedure to lengthen the frenulum,
Oh
and that
shit.
reduces the risk of future tears and sutures. That's the bleeding. That's the only way to stop the bleeding. But there's scarring that can make it more prone to tearing, and
And pain, I'm assuming.
yeah. Like,
Yeah,
no.
they got it says magic point licking his frenulum. Born her Mary Hayes.
What?
It's a thumbnail.
Oh, I did not know where you were going with that.
Oh my God, dude.
These are the pictures that popped up when I put frenulum penile. Um, yeah, some shit, man. Yikes. Since there's no comments, we'll move forward.
I think that everyone's expecting this person to just realize they need to go to the hospital.
Yeah, I think because it's late, also there are no responses, but it is.
Yeah.
Let's see. 31 weeks pregnant and extreme pain under left rib cage. As the title states, I'm a 33-year-old female, 332 pounds, 31 weeks pregnant with my second relatively normal pregnancy. I've had a cold for about a week and a half now. This morning I woke up to go to the washroom and I believe I coughed. And the whole walk to the bathroom, my left rib cage was hurting terribly. I went to labor and delivery. Baby checked out fine, as apparently so did I. That doc never felt the need to come into the room for an exam, as they deemed my coughing from the cold has caused me to pull something, and just recommended heat or ice and Tylenol. But here I am, 11 at night in such pain. I don't know what to do. I got pain in the subside for a few hours earlier, but it's back tenfold. And I just need advice from relief or something else. It could be that I could try. Something else that I could try. Please help me out. I'm sorry, but I'm sitting here thinking and reading, and I'm like, is this a seizure? Thinking in between
I
words
hear
and stuff.
pain. I hear like recurring, not subsiding pain. Did you pick up on anything else, Sia?
I'm looking at it right now, and it is a thing that can happen. And it's because of the expansion, putting a lot of pressure on the ribs. That by itself is just from the pregnancy, so adding a cough into that is going to make it even worse.
Oh.
And then you said it was under the left side, right?
Yes.
Yeah, I mean, I can't see anything concerning about the left side, but for the right side, it would be like liver issues. Um, it sounds like, yeah, like she just needs to she needs to rest more. She needs
Definitely
to
no
do
pressure, no lifting
yeah,
of that.
like gentle stretches or like yoga, maybe some warm compresses. Elevate your upper body to reduce pressure on your ribs. Um, Pregnancy pillows could be good too to help
Is that
kind
those
of
big
relieve
long
some.
ones, like the body pillows?
Yeah, they help kind of relieve the pressure because um
Get this off
I
my
had
screen.
I had twins with my first pregnancy. It didn't go the way that we thought it would, but I did end up getting pretty big with my son, and it was like such severe pressure. I was in so much pain. And
Oh.
then my husband got me the pregnancy pillow, and I was able to lay on my left side, and that started to relieve the pressure from my spine. And because I was so big that it was like compressing on my veins. So I would lose blood circulation really often. I had to elevate my legs and stuff. But the pregnancy pillows can be super helpful, especially if she's having like a lot of pressure on her upper organs.
Yeah, everything gets pushed around.
It does.
I got another one here, you guys. It says, how can I apologize to my gynecologist? 19-year-old female, 5'5", 188 pounds, multiracial, minor pelvic organ prolapse, and a UTI. I don't know. We'll keep going. I've recently had a lot of pelvic and intravaginal pain and wound up at my pediatrician's office. She was examining me and saw something that worried her, so she urgently called the gynecologist's office next door. Super convenient layout of the office building she's in right now. And they took me for an urgent evaluation. They performed pelvic exam, urine culture, and sent me the script for an ultrasound. which I got this afternoon. So I don't have questions about diagnosis I've received or treatment, but I do have a question about how I handled the gynecologist visit. It was a nightmare. I was a nightmare patient. I was stressed and overwhelmed, and the second my pediatrician tried to examine me, I was sobbing. So going to the gynecologist and seeing the stirrups and speculum and everything made it all feel even worse. I was crying in the waiting room with all these poor pregnant women who were just trying to live their lives until the nurse finished with her previous patient. She was lovely and really gentle, but I was still panicking when she tried to insert the speculum. She used the smallest one with a lot of lubricant, and she still had to do it twice before I was holding my muscles too tight the first time. Although I wasn't trying to clench anything, as an aside, I don't actually know how to relax those muscles because I wasn't trying to hold them tight consciously. The second time she managed to get it in and open it, but could not hold it open for a bit before I started shouting, ow, ow, ow. And I was crying the whole time too. Then she wanted to take urine tests, but I wasn't able to go to the bathroom. I think I was too wound up. So it was nearly an hour of me in their waiting room again, drinking a ton of water until I could. I feel like I owe these people a present or something. Everybody in the office was so nice to me and accommodating of me and my mother with me. I just feel guilty for how I reacted. I don't know how I was panicked, how I was so panicked. I only have a bit of sexual trauma and it didn't involve me being touched. So it wasn't like I was triggered. I think I was overwhelmed and I want to apologize effectively for that because I was really treated very well. A lot of those terms, I'm sure, are female terms, and I was making facial expressions that I didn't understand.
Well, so all of that is completely and totally traumatizing.
Oh yeah.
Yeah, I remember my first OB visit and it was terrible. And it was extremely painful. Um, it's not easy to go through, and it's not something that you need to apologize for because these women that do it, the men that do it, they're used to patients like you. They're used to that because it is something that sucks, it's painful, and it is scary, especially for younger patients. And then adding on top of that, if you do have sexual trauma, it doesn't matter if they touch you or not, it's still terrifying.
Exactly. She said a bit
Yeah.
of, so she's diminishing that in her own testimony and bringing up the scene, how it presents herself by saying the sight of those stirrups and the speculum. You can tell exactly how devastated she is by even
Mhm.
imagining, reliving this experience. And did I hear right? Pelvic organ prolapse and urinary tract infections.
That's yeah, he said minor pelvic organ prolapse. How does
Ouch!
that happen?
How is that
Yeah,
minor?
that's not
That's
minor.
okay. Pookie, just to put it in perspective for you, organ prolapse is when the organs spill down, so they end up into the vagina. And I understand how there can be a, minor and major, as in like how many organs fall through, but
Or
either
maybe
way,
like the extent of how far they fell, but still it's painful. I mean, it's like,
exactly.
yeah.
Why, when you put gyno stirrups, you guys already know what the fuck is popping up, right?
Yeah, we know. We know. Yep.
On you just opened up some fetish shit. That's in your history now. That's in your history. So have fun with those pop-ups.
No, there's gynos, but they're just actually showing the real. They're showing some shit.
And they're not fun either, by the way. They are terrifying.
This doesn't look fun.
Yeah.
They put
I
And the
the legs
UTI
in
on
the
top of it,
stirrups.
aren't UTIs really painful?
Oh, yes, majorly. And then not only that, but if they don't get treated right away, then you start getting the kidney pain. And if it goes to your kidneys, if the
And that's on
infection
her
spreads to
back
your
now.
kidneys, dude, that's like life-threatening. That shit is gnarly.
Yeah, that's some major organ systems all involved now, not to mention like your organs are not in the right place.
I wonder,
It'll be
because
good.
of what she said about
How
her
is
and
she
her
not
mom being
inpatient?
there together. I wonder how her mom is reacting to this, and if it actually is her diminishing her stuff, or if it's her mom. Because that
Glad
is a
you caught that.
possibility. Yeah.
Yeah, that is a big part of this story. For
Because
sure.
it's like that is so I had to go through my um essays on my own with my sisters and therapy. I couldn't talk to my mom about that shit. And the second that I did, she blamed it on me.
Oh,
So
man.
that shit is rough.
Yeah.
That's the kind of thing that can change the anatomy forever, it looks like, hindering them from emptying her bladder ever again because of like the urethra getting kinked up somehow.
Yeah, you gotta
Is
do
it
pelvic floor therapy for that shit.
Oh yeah, that's
is
a
it worse because
long-term
it's someone
recovery.
you don't know?
What you saw?
So is it worse because it's someone you don't know?
Absolutely, because we have no way to reach out and determine what her situation, what her support system is, if she has one.
Yeah.
No, I'm saying for the guy now doing what he's doing with the stirrups. Is it more uncomfortable because the fact that you don't know this person? Or you
I
think
mean, I've
just
never met an OB that's like uncomfortable. They're
that's really
usually pretty
complicated.
like, they're just like, okay, hop in, we'll get it done.
Yeah, I think I just treat those like any other doctor's appointment, know what to expect, and if anything feels off, like get the fuck out of there.
I've never apologized for the way that I've acted in an OB. I have severe pain when anything goes up there. That shit is not fun. And
Oh,
I
that's the
take Tylenol.
endometriosis, right?
Yeah, it is. I take Tylenol, I'll take ibuprofen before I go in, and none of that shit helps. It never touches the pain. My legs are all freaking shaking and shit, and
Oh
they're
no.
trying to do their stuff, and I'm just like, I'm sorry, I can't control it. But like, have I ever said sorry to them? No, because they've been through this shit. It's
You're
not your
No,
supposed to
fault.
be making it better for you.
Yes, exactly.
The
And it sounds
patient
like
should
they're,
not apologize.
yeah, it sounds like their team did well. And she did sound like she appreciated the way they handled things because they didn't make her feel bad.
Yeah, at the end of the
Um,
day, it was a good review.
but whoever did make you feel bad, you are not okay, person. That is not okay. And you need to get some proper support in place because it is not your fault.
I would love to see how this conversation influences Pookie's painting.
so like I'm looking at this and I've got to the bottom where it's past the floor. Um, they have videos of it actually, the actual gyno doing what he's doing, and she doesn't really look like it's bothered her.
I mean, I don't think it bothers every single woman. Some people are used to it, but for people who have like conditions that cause pain, especially in her case with the prolapse, um, that shit hurts like hell.
There's no room in there even for a speculum.
Yeah.
What the hell is a speculum? See, now I'm looking up
It's
everything.
it to put it in simple terms, it basically looks like
I'm finna find
uh
out.
I was gonna post it for you.
It's all right. I can do it like that.
he's deep diving, let him deep
Takes a
dive.
second.
You'll remember it better this way.
Go over the images.
You
Oh,
are learning
yeah.
so much from this book.
Oh, right.
There's a sound that it makes too. It's this like mechanical clicking sound as it opens.
Oh
Okay.
yeah.
This is some stuff. So
Yeah, it ain't fun.
How much do they need to open it? Because that looks like it's a little much.
They need to be able to see down to your cervix most often.
And sometimes, get a sample or do whatever they're doing.
Yep.
Um,
There's even worse things than this. There's pap smears.
I know, but I mean, this right here, that's what I was trying to figure out for the speculum. Is it okay? Yeah, I think you already answered that.
I mean,
Basically,
ideally, it should never hurt if
yeah,
they lubricated sufficiently and you're relaxed to begin with. Another thing that stood out to me was when she was saying that she didn't know how to relax her muscles, but at this point with the prolapse, her muscles aren't functioning. Something's torn.
yeah,
Something is,
they're
yeah.
constricted already.
It's not up to her to release them at this point or relax them. So that would
yeah,
definitely be like a, whatever they call it, that shot that anesthesia. That just seems like
Yep.
a anesthetic kind of assistance.
this looks like okay. They have the clamp. You guys already know what this shit looks like, so there's no reason to be explaining it. But it's like, how big is this thing? Is it like this? Like
The ones that I have seen have been like, I can't do this properly. I mean, let me set up my
use
camera a
your
little better
arm, go
here.
like this.
So this is my arm, okay? This is my arm. It's from my elbow here, and it's not this thick, okay? But it's from my elbow here down to like my watch. Sometimes longer, like up to my wrist. And that's like a good foot long.
I'm sorry, guys. That is, I could see it right here, but I was just wondering, like,
Yeah,
I mean, 4 or 5 inches is typically the good enough length that would allow for enough, I don't know, visualization, I guess, into the canal.
hmm
And they even have special speculums for virgins. Nobody who's ever been penetrated, the blades are shorter and like more narrow.
And I think they have like a little bit of a larger opening so they can see through without having to open much further.
Oh,
so
okay, right.
these,
Open,
Yeah.
yeah.
a few of these, they look really small. I understand you said a foot long. That's like fucking insanity, bro.
It's
Um,
dependent upon how long your endometrium is, like the canal, because each woman has a different length.
I know.
So, yeah, it's a whole thing.
So like, this is, I got a decent sized fist, is what I'm saying. If you get where I'm coming from, this stirrups, it's it's wild. My fist isn't a foot long, but this shit is crazy. You guys have to go through.
There's way too much shit that we have to go.
Yeah, and
Yeah,
then
and
there's
just
like,
trusting that the OB is going to be careful and delicate and like know what the fuck they're doing. And
And they are not always. They
this
are
OB
not.
doesn't look like he's being any type of anything. Her legs are in the stirrup, and he's like this. Both of them. That's how it happens. Damn.
Yeah, when they were doing I was on so much Valium, but when they were doing my hysteroscopy, my surgeon had her whole hand lubed up. It was open wide. So like it was a whole, because she had to go in there and retrieve a sample of my uterus. So she had to go through the cervix into the uterus with tools and stuff. It still hurt, and I had the numbing shit, and I was on Valium, and I couldn't walk for like a week.
Mm.
Yeah, shit hurts. Also, I need to grab a charger. Ugh.
Yeah, so I was watching this video and we'll stop there. We'll go to something else. I thought about it.
All right, well, you guys check the chat. Have a good one. And we'll get back with you. So, Sia, how are you feeling, by the way?
Here, give me 1 second. I'm gonna grab my charger before my phone dies.
Okay, all right. I gotta get Buddy set up anyway. We'll talk to you later.
All right, we'll be here.
Yeah, the sun's gonna be a couple hours.
Thank God, everyone is asleep.
Great, huh?
Oh, did Kate leave? I didn't realize she was leaving.
I think she said she'll be back though.
Oh, okay.
I think.
I hope. She asked me a question and then I didn't respond.
So I got one here. It says, can't tell what's going on. 25-year-old white male, 5'11", 133 pounds, and I've been having problems with my stomach and my lower back for 3 weeks now. And I feel my situation is a bit unique due to diet, personal life choices, and other things like Crohn's disease, chronic migraines, pain disorder, and GAD. I take Coralin, which is for migraines and contains 400 milligrams of metamizolol, 40 milligrams of Drotavarin, and Xanax as needed. But I only have done that twice. I'm going to make another post about the overall health that I need a bit help with. But for now, I got these blood tests back due to concern of infection, celiac disease, and low blood cell count due to a medication I take daily that has metamizole in it and can cause a agranulocytosis.
A granulocytosis.
Oh my goodness, I don't know how you know how to say this. I was about to spell
I've
it
gotten
out.
used to medical terms by now.
I was about to spell it out, but yes.
It's a serious condition that involves a severe decrease in white blood cells and is a major concern associated with metamizole.
Okay. So they said it can cause that word that you said, anagrove something. I've been having lowered appetite and crazy stomach pain with constipation and diarrhea alternating. I have Crohn's, but it's supposed to be mild, as my doctor said a while ago. I also had kidney stones 2 years ago and chronic uveitis for 1.5 years. And about 2 months ago, I had it spread to my kidneys a bit. I feel similar pain in my lower back, and my urine is dark colored and smells bad. And also, I have a bit of blood in my urine, which has been going on for months. But my primary care says it's normal.
Oh my God.
He has been a bit rude and brushed off my uterus a few times now, but I insisted on test, and he rudely called me today and said that I don't have any infection or celiac disease and that I should follow up with GI or the ER. But I followed up with my GI and they have no answers for me after doing every test in the book for my GI issues from before that started in 2016. I basically just want to know what your opinion on these results are and what I should do because I feel pretty bad recently and it's making life more difficult on top of my daily migraines and crippling anxiety I developed right around when I had my UTI that went into my kidney. Sorry if I'm confusing. I have a novel of things I want to write, but I'm going to make another post about my other issues separately and more formatted. I just need some quick help with this because I feel stuck right now with what to do. and don't know how to feel about these results since it clearly has high markers of blood cell count is low, which is scary because of that medication with metamizole. For reference, I also only eat bread, mashed potatoes, golden Oreos, and vegetable butter, and that's it. Please help. Um,
Okay, so let me give you the breakdown on this medication real quick, because it is terrifying. It's banned in the United States, the United Kingdom, Canada, and some other countries due to its safety concerns. It's not just restricted, it's completely banned. But it's still used in other countries such as Germany, Russia, Mexico, and parts of South America. So I'm assuming that's maybe where this person is in one of those countries. But basically, it sounds like this person has liver issues and kidney issues.
yeah, I was gonna say the dark urine sounds like that kidney thing, kidney issues.
Yeah. And that medication can cause both of those, along with the granulocytosis. So a low white blood cell count leads to more infections, most likely probably why he ended up with the UTI. Then the UTI is also connected to his kidneys, which he could be in, a stage of kidney disease. And then the liver issues would cause the severe stomach pain and the back and forth bowel movements. So he needs to go see another doctor if possible, because the second opinion on this, or even an ER visit or something like that, would make these most likely way more noticeable because they're not testing for the right shit. If you test gastrointestinally, you're only going to see gastrointestinal. If you test, like, it needs to be a full range of tests. It can't just be one specific thing. Um, and that drug is banned in so many countries for a damn reason. So, yeah, I would be scared. Um, and I would probably either go to an ER or get a second opinion from another doctor because all of those issues that this person just said, those are very severe issues.
Yeah. Kidney stuff is nothing to play with.
And especially not liver either. Both of those things kill you, man.
Yeah, it's rough. I got another one here. It says, "Mom smells of garlic and vinegar." 37-year-old female asking about my 67-year-old mom with HX pancreatic cancer. Vinegar and garlic odor. My mom has pancreatic cancer and is S-P, Whipple, 12 rounds of chemo and mRNA vaccine trial. She had labs and CT which were normal in early July. Over the past couple weeks, my sister and I have noticed my mom smells like garlic and vinegar. It's like it's coming out of her pores. She is meticulous with hygiene. I believe it's medical related and not diet either. I have read about feeder hepatitis. I'm sure you know what this word is. Hepatitis. Yes.
Hepatitis. Is it with a C or a K?
HEPATICUS.
Hepatitis. That's a flower. Oh, feeder hepatitis. Death of the breath of the dead, a chronic bad breath odor that indicates late stage liver disease.
Okay, so the person said, I have read about feeder hepatitis, and it sounds like what she has. Could that be possible with normal labs or scans a month ago? She states she's having night sweats and pelvic pain that sound like sciatica. She won't,
Sciatica.
she won't call her oncologist because if cancer is back, knowing won't change anything. I'm not a doctor. I'm a patient of another brand, so I can't give advice, and there's no comments there besides the bots.
Pancreatic cancer can cause, in some cases, volatile organic compounds, VOCs for short, that could be detectable as an odor, though this is not likely to be noticeable to most people. Um, hmm. I mean, that sounds like it warrants more tests, because it's definitely not good to, yeah. I mean, I've known people who have had that smell. They had liver disease, due to alcoholism. And, yeah, it's usually associated with liver issues, but I guess it can be associated with pancreatic issues as well.
Okay, so I got another one. It says itchy bleeding mole. I've had this mole for a while, but I don't know if the shape changed due to being covered by my beard. It's about 6 to 7 millimeters, so around 1/4 of an inch. My girlfriend said numerous times over the past month that I needed to get it checked, but I keep forgetting. It itches sometimes and occasionally bleeds. The itching, sometimes slight annoying pain, has become more noticeable in the past few weeks. I called my GP, but they're going on a holiday and I can only visit them in 4 weeks. So I thought I'd ask here if anyone can, at the very least, tell me their impression. 36-year-old male, non-smoker, 5'11", 181 centimeters, 187 pounds, 85 kilograms. Location, mole jaw, generally in good health. Let's see what this picture looks like. Doesn't look that bad.
I mean, I have one right here.
It's not that bad. It's there, but it's itching, he says. So the itching I could understand, because
Yeah, I mean, it looks like he picks at it,
yeah,
which makes it look worse. But I mean, this one gets itchy, and sometimes when I pick at it, it bleeds.
there's
Um,
another picture. Yeah, it looks like he picks at it.
yeah, it definitely does, because there's a lot of irritation around it.
Yeah, if it's on the beard, I can imagine him just scratching like this all day. I'm so happy I don't have to.
Yeah, beards are itchy as hell. My husband, he shaves quite often because of that. But I mean, yeah, any changes in a mole, because they're not supposed to itch, or hurt, or bleed. But if it was bleeding on its own, or if it was like cracking or something, I think that would be a different story than picking at it. Because if you're picking at it, then it's definitely gonna bleed, you know? Um, but the itching, I mean, it would warrant a checkup, but I wouldn't be too worried. I have a lot of moles, and I've had some pop up recently, just out of nowhere. But I haven't gotten it checked because it's not that concerning. Unless you have like a history of skin cancer in your family, then I would say that that's more concerning and you should probably get that checked out. But I'm not a doctor.
We're not doctors.
Yeah.
Um, okay, I got something here. It says, oh, I know these freaking ones. Okay. Ones with sexy popping up, so we'll move on. It says, hi. Hi, all. I'm a 23-year-old female, white, no drugs, smoking, vaping, rare alcohol, no diagnosis, take some vitamin D, vitamins, and castor berry daily, and nothing else. Notice lump before starting both. Have a weird lump on my right ankle. It doesn't hurt or impact my movement. It's not tender to the touch. I can press on it rather hard without issue. If I swivel my fingers on it, roll it around under my skin, it almost feels kind of gritty inside, if that makes any sense. It feels fairly soft. No family history of bone cancers, inherited joint issues, etc. I'm not athletic, but I do try and walk a couple miles a day. Don't always hit that goal. I'm healthy weight gain for my size, no history of ankle leg trauma. I'll put an image on, I'll put an image of the lump in the comments. There goes the lump. It's very lumpy.
It is lumpy. As somebody who has two lumps that I was terrified of initially,
There you go.
that looks and sounds like a
Here's your
lipoma.
lumpage.
Do you know what a lipoma is?
No, I don't, but the other ankle doesn't look much better.
It looks about the same, but she didn't say anything about there being one on both.
Yeah, but look, they both look the same.
Yeah, they do.
Really similar. I guess only
Hmm.
one is hurting, I guess. But
I mean, I get pain and it gets itchy on this one on my back, and it's very noticeable under the skin. Like if I was to take a picture of it from the side, it would be visible. It pushes out, it protrudes. Um, but like a simple doctor check, you go to the doctor, they move it around. If it doesn't move, if it's hard as a rock, if it's not soft, then that's concerning. If it does move, that means that it's not connected to anything, which usually means it's benign. So the ones that I have one inside of my stomach area, my abdomen, and then I have one on my back, and those are both lipomas. Oh, I actually have a third one. It's on the back of my neck on a lymph node. And yeah, all three of them were diagnosed as lipomas.
oh, okay. Yeah, so I got something else here. It says unexplained bruising for 7 years. Female, 39 years old, regularly take Synthroid iron pills, Wellbutrex, Wellbutrin Butrin XL. I've been having this problem for 7 years. I've seen a dermatologist and a hematologist. Both doctors no longer kept me in their caseload as blood work came back normal. I was tested for a bleeding disorder and vasculitis. The derm thought I was clumsy and didn't know how I bruised, and that I have old lady skin that bruises easily. I finally am getting an appointment with an internal medicine specialist. This is what happens. My skin feels like it burns or itches. I'll scratch, nothing major. Petechiae. That's what it looks like.
Petechiae.
Petechiae, yeah, petechiae form and then red bruises, very red, very rarely. Is there just one bruise but many in the spot I scratched? It first started on my upper thighs and then legs and now elsewhere on my body. It doesn't happen all the time, but I have flare-ups. For my last blood work, I waited until I had a flare when I felt that intense burning with the few blood results being off, but the doctor had no concerns. Any ideas?
That actually happens to my husband. Um, and he has never been to the doctor for it, despite me telling him to go. But from what we understand, it's a hereditary issue, and it has to do with like vascularitis, inflammation of your veins and stuff. Um, So it's like, it's nothing like super serious, but I mean, it's obviously bothersome. And if it's such an intense burning sensation, he doesn't get it that often. And if it happens more often for you, then I would suggest, yeah, just kind of waiting for the internal medicine doctor. I mean, I've never been able to figure out anything that could be done for it. Um, Other than I guess being on like maybe inflammation medications, something like that.
To say. Yeah, one says 24-year-old female, 5 feet, 200 pounds, 1 month long viral infection. Is my doctor right, or should I get another help? Viral infection. 1 month ago, I was having symptoms of typhoid problems that runs in my family. I got blood tests and it was normal. Then a week ago, my primary doctor had me come get another thyroid test. This time, my erecthyrosis, erythite, I don't even know how to pronounce this.
Can you spell it? Because I can't.
ERYTHROCYTE.
Thyrocyte.
Virocyte.
Basically another name for a red blood cell.
Okay, it said this is my thyrocyte sedimentation rate, and my C-reactive protein was not normal. My doctor said that it was a viral infection, but last month the ER doctor said the same thing when I had a sore throat and my voice was raspy. My primary doctor wants to do another blood test in 3 months. I still have symptoms of fatigue, nausea, headaches, and on and off sore throat. I'm missing work because of it. And it's been a month off and on symptoms. I did ask my primary doctor if I can get tested to see what kind of viral infection I have, but he said there's too many viral infections to pinpoint the one I have. What should I do? Would cold medicine help? Should I get a second opinion?
I would say second opinion, because the month-long viral infection kind of sounds nuts.
Yeah. Yeah, viral infection, never had one, but that does sound nuts. A lot of those erythrocyte, that was a hard one to say. I was never gonna say that. Erythrocyte.
It takes me a second to like, I gotta look at the word and then I'm like, okay, I figured it out. But yeah, it's taken me some time to learn all of them.
It looks like thrombocyte. Yeah, so you got it.
Erythrocyte.
There we go.
Yeah.
Okay. It says, no, we're not gonna go there. Odd itching, stabbing sensation with finger, and other issues with hand and arm. 19-year-old FTM. What's a FTM?
Okay, there's a couple of things it could be. It could be female to male, or it could be first time mom.
Okay, I'll keep reading and we'll figure it out.
Yeah.
19-year-old FTM, currently on testosterone. I've
Oh,
had odd pain with my left arm going from the elbow to my fingers. My main issue is with my fingers, where there's itching feeling specifically with my pointer finger at the moment. There's also a slight stabbing sensation. Could push through the feeling if I needed, not extremely painful. That goes through my fingers. If I tap on my screen too harsh, my fingers don't itch unless they get this stabbing sensation, at least from what I've noticed. Maybe not important, but there's a sensation within my forearm. Felt most of the underside, side attached to the palm. That makes it feel like I need to stretch. However, stretching does not relieve this discomfort. I felt it necessary to include that I'm testosterone as it applied through a gel that goes through the upper arms. I'm having more issues, sensations from the arm, but those specific symptoms have appeared and disappeared before. They're more important as I've experienced them before.
Hmm.
Itching
It,
fingers and arms.
it says that that can be a side effect of testosterone.
Have you found out what FTM is?
When I heard testosterone, that's when I realized, yeah, it's probably female to male, so they're in
Oh
transition.
yeah.
But yeah, it says that it can happen. And I guess it could be related to, I mean, yeah, it could be something else like pinched nerves, poor circulation, vitamin B12 deficiency, autoimmune, certain medications. But it says that tingling and itching can happen from um, testosterone use, especially if you have diabetes, it says. I don't know if this person's ever been tested for that, but maybe that's the thought.
Yeah, I never heard of female to male till now. I'm reading it on my screen, but yeah. Let's go to the next one. Muffled hearing, smelly clear discharge. Male, 39, 260 pounds, 6 feet tall. History, occasional ear infections due to cleaning out impacted earwax. I can get a lot of earwax build up quickly anyway. For the first time last week or so, right ear suddenly became muffled and it felt full. Went to the primary and said it looks like I might have a congestion. Went to the urgent care after I had an instance of some smelly, moldy smelling clear liquid seeping out. They said it looks fine, but maybe be fungal infection. He was not sure. I got a camera with my 2 eardrums. Look so different. The left feels like the left feels fine and looks smooth and normal to me. The right is lumpy and odd looking. I scheduled an ENT, but it's 2 months out, and if this is something serious, I don't want to wait too long. Any ideas? No pain or other feelings other than foolish and slightly muffled hearing. I can still hear pretty good, but it's muffled. The seepage was one time and hasn't happened in 3 days, and I have no continued leakage. Earwax. I don't exactly know what to do in the ear department. Oh, yikes.
Yeah, I haven't really ever had an issue like that. Well, I bleed out of my ears and my nose, but uh, everyone that I've gone to says that it has something to do with my brain. So, um, I've never had an ear infection except for when I was a little kid.
This is the picture. That's the ear.
That looks, yeah, that does kind of look fungal.
Fungal, you say?
Yeah, if like like a fungal infection.
Oh man, no. Yeah, that
I
looks
don't
like
know
it
if I would
sucks.
have no idea how you would treat that. I
Yeah,
guess antifungals, but yeah, then that would suck.
looks like it. Okay. It says left hand suddenly numb. 30-year-old female. Omeprazole.
Omeprazole.
Omeprazole. You know all these medication names. Pepsid. Omeprazole and Pepsid. 5'2". I was sitting up straight watching TV, and my left hand suddenly went numb for about 2 minutes. I don't have any other symptoms except I've been fighting a stomach bug as well, but I think that's unrelated. That suddenness was so scary. Should I get it checked out, or is it okay because it went away? If I were you, I'd like to keep everything running at the right pace and how it's supposed to run. So I'd go, not to the emergency room, but I'd tell my primary. I'm not going into the emergency room just for my hand.
Yeah, because apparently those two medications can lead to like nerve damage, and hinder the absorption of vitamin B12. So yeah, that I would definitely, you don't want a numb hand.
Right. Yeah, I need my hands out of everything.
Yeah.
I need hands. I don't know what I would
I can
do.
handle a numb leg, but not a numb hand.
Okay. Trying to find more notes and comments. Abdominal pain for weeks. I'm not asking for medical advice, but any help or suggestions are welcome. Okay. Background: male, 44, but overweight. Probably just being real. Hiatus. Hernia diagnosis 3 years ago. Has been fine since. I feel like I'm so far away now. He said, has been fine since. About 3 to 4 weeks ago, I started getting real bad pain throughout my abdomen, upper, lower, and sides. Felt really bloated. Thought it was a hernia related, but never had a pain spread like this. Saw a doctor and said suspected appendicitis due to being tender around that area and said keep an eye on it. Next day I saw out of an hour doctor, out of the area, and said, okay, my bad. I read the same line over. Next day, saw an out of hour doctor, had blood check, still in pain, couldn't sit without being in pain on my right side, abdomen, bloods were negative and appendicitis, and I was given Maprazole and sent on my way. We just said that word a few minutes ago.
We did.
Omeprazole? No, Maprazole.
Omeprazole.
Omeprazole. Wow. Last 2 days it's been bad again, and saw the doctor, and he said possible gallbladder issues and booked me in for a scan. God knows when. I'm really struggling to sit. It's worse after I eat, and noticed it being real bad after coffee or a big meal. Main symptom is the right abdominal pain creeping around the back of my lower rib area. Any tips or advice welcome. Thanks in advance.
Oh
First,
gosh, I would
somebody
have no
said
idea.
could be gallbladder. Stick to as low fat diet as possible.
Yeah, that makes sense.
I know nothing about anything other than epilepsy.
Yeah, I guess I've had too many issues, so I know quite a few things, but I've never really had an issue with that. I do get GERD though, which is what omeprazole's for, but not bad enough to be on a medication for it.
Okay. Well, oh, that's way too much to read. It's too late for that. Yeah, this medical stuff is a lot of information they're passing on.
It is.
Okay, yeah, it says 28-year-old female. Oh, 28-year-old male, 6'2", 205 pounds. Yesterday, when I left work, I noticed it felt like something was in my shoe. It kept getting worse until every step felt like my whole foot was stepping on something. Nothing painful, just uncomfortable with an itchy feeling with swelling. Went to bed, woke up, and my foot was doing much better, but now going through the same experience with my hand, exact same feeling. Now my other foot is following the similar trajectory. Any ideas what this could be? Out of town, so I can't go to my primary care, but I will go to an urgent care. I feel completely fine otherwise. Hand and feet.
Hmm.
Like I
Nerve.
said, my limbs, I need my limbs. I'm going to
Yeah.
see a doctor if I can. Yeah, as soon as possible. I need all four limbs, a good heart. Yeah, good kidneys. I think everything else I could live without. Actually, no, I need a liver.
You gotta have lungs too. You gotta be able to breathe.
Yeah, there we go. Yeah. What would you do if your hands and feet went down and it switched sides?
I would
Actually, it didn't feel
definitely be
numb. I think
scared.
you said there was a slight pain, like it was something in his shoe. Itchy feeling. I'd take the shoe off and check, first of all, just to rule that out.
Yeah.
Really, I mean, to rule that out, you gotta check. You gotta look at it.
Like imagine if there's like a spider in your shoe or something.
Right. When you said that, everybody be there's a snake in my boot.
There's a snake in both of my boots, and then it bit my hand.
Right. All right. It says I told my doctor my mom was lying about my symptoms. 15-year-old female, 80 pounds, 5 feet tall. She's a little bit. I posted here once before because I knew my mom was lying about me being sicker than I was, and I wasn't sure how to handle it. I took everyone's advice and I ended up telling them at the next appointment after we checked in. I said I had to go to the bathroom and I left a note with a nurse. I think my doctor maybe looked at it before the appointment actually because it took a really long time for us to go back. And then in the appointment, the doctor was asking a lot more probing questions and clarifying questions and pointing out inconsistencies, my mom said. And then he asked to talk to me by myself and my mom by herself too, actually. So I'm seeing a team of doctors now who wanted to verify some of the diagnosis that I had, and they admitted me to do that. Like in the hospital, and there was always a nurse or someone in the room with me. I'm not 100% sure because no one actually told me this is why, but I'm guessing it's why it was to make sure my mom didn't say or do anything or give me anything. Is that something they'd actually do? It sounds so dramatic, or maybe it's normal to check things out in the hospital like that. I don't know. Anyway, they're changing some of the diagnosis now, and my mom is talking with a counselor. She still maintains that she's not doing anything to me, and I'm really sick and just getting influenced by crime documentaries. Adding, she called me listening to a podcast for context, but things are a little better. She's not supposed to be in charge of any of my meds now. I do that myself, and I write down everything I take, and when I journal, so there's a record. And I'm not taking any hydrochloroxine anymore. Thank you guys for telling me to say something. I was really afraid I was going to get in trouble, but No one was mad, not even my mom, actually. They were nice about it, maybe a little stern, but nice.
Well, it
The
sounds like
first
a
comment says, you did a difficult but important thing to protect your health and safety. This is not about your mom, it's about you. I'm so happy to hear your update as I read your original post, and I hope you can get all this sorted out. Keep looking after yourself like this. Um, I don't have any advice for a little girl because I don't understand.
that sounds like that one documentary. Um, I forget the name of it, but it was a real story about a girl who,
Oh yeah, and her mom was keeping her sick.
yeah, and then her boyfriend that she met online ended up murdering her mom, and then they ran away, and but then they got arrested, and then she didn't, I think she only got like a few years while he went to prison for life, and he had like mental issues.
Man,
It was a whole thing. But I forget the term of that, but there's like a word for parents who do that type of stuff. It's like a mental issue.
for some reason this candle was sitting here, so I lit it. Um,
You grabbed
after,
it a little bit ago.
yeah, I forgot, and then I just like let me light this. Um, so someone says on the verge of brain death. Please help me. 31-year-old female, 5'7", 160 pounds. I feel like I'm gonna die very, very, very soon. I am rapidly losing brain function. I have lost all memories of my life. I cannot picture anything that has happened recently or in the past. My brain feels empty, painful empty. My little voice inside my head is disappointing me as well. I barely there. It's barely there. My body is giving out on me. My arms and legs are weak. I can barely move. My stomach is in so much pain. My heart skyrockets every time I try to stand up. I don't know how I am able to do. How am I able to type this? But I am desperate for help. I went to the ER and told them everything that is happening, and they did a CT on my brain and said it looked fine and sent me home with a script for sleeping pills and told me to follow up with my doctor. I'm afraid I'm not going to make it to my doctor. I feel like I am not even going to make it till tomorrow. Please, somebody help me. I don't want to die. Oh,
That is a lot to base off of something that hasn't really been checked out yet. Um, 'Cause I mean, as somebody who got a normal CT scan, despite there being clear issues on an MRI, that there is always a discrepancy with the accuracy, but the symptoms that you're talking about don't really coincide with each other. Stomach pain, and then memory issues, and then legs and arms not working, sounds like. Um, I mean, I don't really know. It doesn't sound like something that you're gonna die from, but yeah, I don't know. That one's a tough one.
you ever heard of the word hypochondriac? That's what it sounds like.
That's what it sounds like anxiety.
This person looked at something on Chat GPT and it scared the shit out of them.
And that's why ChatGPT says don't use it for medical advice.
But they still give you medical advice.
Yep, they still will.
Um, yeah. Let me go through the comments. Somebody said, gonna need more info. When did it start? What was gonna happen in your life when it started? Anything make it better or worse? Anything run in your family? What are your labs like? What does your PCP say? And the OP responded, I'm not sure when it started. All I know is it's getting worse and worse. And I feel like I'm dying. Nothing makes it better. Dad died of dementia in his 50s. I have always had the fear of losing my memory, even before then, even been its biggest stressor, and now it's killing me. My PCP just says it's depression, lack of sleep, blood work. It's all good, all normal.
I mean, yeah, you'd see something, you know, like if you're dying, they're not gonna not see something. It sounds like her PCP uh thinks it's anxiety and or depression as well. And then the fear of losing your mind because your dad did would just add to that and make it even worse. So, um, if they're not finding anything, then you're not gonna, yeah, you're not gonna die. You're not gonna die.
Die is a strong word.
Yeah. Like you can feel like you're gonna die. Felt like I was gonna die, but then I wasn't actually dying. And when I did actually almost die, I did not feel like I was dying. I
I was
wasn't
gonna say
there.
that. What does dying feel like?
Like I literally don't remember most of it. I just got told most of it afterwards, and so I was like barely there at all. So if I had died, I just would have, you know, just I would just gone. I wouldn't have really known what was happening.
Yeah, they told me I died, but I didn't understand, but I didn't know what it felt like because they brought me back. It was because I had a seizure. They said my heart just stopped beating for a certain amount of time or something like that. And yeah, um, they got me back. I'm assuming they did that thing where, that.
Yeah.
I'm assuming that was a big assumption, but it just looks fun. I mean, yeah. Someone else said, "Can you tell us more about your medical history? Do you take any medications, prescribed or over the counter, supplements, or recreational drugs, any alcohol use?" And the person did not respond.
There's a possibility right there then.
So the person who made the post said, "Wow, that's crazy. So sugar and stimulants make you go numb. The blind in one eye. Who would have thought? I'm so glad you were actually able to figure out what it was so you could get better. That's what I hope and pray for." There's negative 80 on this.
Probably because of
Oh,
I
there was
don't
something above it that got removed, and it says because it's bad advice. Yeah.
that makes sense. Yeah. Um that would be feeding into this. Um I mean, you could go on the longest journey that you want to be able to go to different doctors and keep searching for a diagnosis, but if you everything keeps coming up clear, then you're not gonna know. Like when I started having seizures, there was very obvious things that were wrong with me. There were physical signs, there were physical symptoms, there were tests done that showed things. Um, and so like if there's something wrong, you're gonna see it. But to continue down the path and continue finding that absolutely nothing is wrong with you on no matter what test you get done, that's just hurting yourself, you know? And not only that, but costing a lot of money.
Someone said date passed out 3 times in a row tonight. Drugged? Question mark. Her stats: 35-year-old, 140 pounds, 5'5", non-smoker, drug-free, two alcoholic drinks weekly, max. African American, isn't on any medication besides IUD, USA. Still kind of speechless about the whole event, but I was out with a date to see Ozzy cover band a couple hours ago. We were less than an hour. We were there less than an hour. We had one drink each. We were standing, waiting for the band to start up. Our drinks were empty at this point. She tells me she doesn't feel good. She feels like she's going to pass out. Vision is fading away. I take her 10 steps to the bathroom hallway, and she drops like a sack of potatoes. She wakes up 30 seconds later, not realizing what happened. I help her stand, and we start to make our way to the front door, and 5 steps later, she drops again. When she woke up this time, she didn't know where she was, asked if she was at home. I explained to her where we are, asked if she can stand up. She does, and for the third time, she drops. Unresponsive at the moment, I scooped her up in my arms and carried her out. The whole time she was saying, "It doesn't feel okay," and is scared. We didn't call 911. I honestly was scared myself and didn't know what the fuck to do. We sat on a bench outside until she was able to recollect herself, and I helped her to the car. She is now sleeping on the couch. I took her temperature, it's 97.7 degrees. She said at one moment a guy brushed up against her and possibly added something to her drink. What would make someone pass out 3 times in a row? I didn't rush her up or anything. It was an instant drop. Never seen anyone pass out like this before. I'm wondering if a blood test should be done to see if she was drugged. If this doesn't belong in the sub, please remove. She sounds like she's been drugged, passed out 3 times in a row, like every time you stand up, and then like gets worse and worse. Second time
Yeah,
she didn't remember where she was. Yeah, that's rough.
yeah, that
I'd take her to
sounds
go
like
get a
something
blood
like that.
test.
Yeah, I mean, honestly, I know you guys are probably scared, but I would have called 911 because you don't know what's going on.
Yes. The first comment says, next time call 911. There's always a risk for airway compromise, especially if she was drugged. Don't ever feel bad for contacting 911 while you yourself were panicking. That's understandable. I promise we don't judge. This is literally what our job entails and we are trained to do. Well, that's a response from a paramedic.
Oh,
Is my 12-year-old son really having mental well-being issues? I'm so lost. Daughter, almost 13, very high achiever athlete who was #1 in the country in her age group in her sport and does another side sport as well, travels interstate and overseas. A lot for sport, absolutely loves it, and we do not push her. High achieving academically in a selective high school that takes up to 15% of students in that state. She's organized and intelligent. She has many friends and social, driven and always energetic and keen to doing something. No signs of depression or well-being issues. She has a phone and she takes a bus to school sometimes and she is a lot. She is away a lot. I need to contact her. I also don't want to be overly strict parent, so I try to monitor as much as I can. I have I have deleted Snapchat and TikTok in the past as I saw her writing dark things and talked to her about it. She said it wasn't real and doesn't know why she did it. A teacher at her school once saw her TikTok and contacted the well-being officer, and they said that there are no signs of mental illness was or well-being and no issues at school. It was all banned again, and she knows. I check her phone randomly. I hadn't for a while, and she downloaded Snapchat and TikTok again. There are 2 boys she texts who she knows from sports, one in the country, but another in another area, who likes who likes each other, and another in a nearby country. Most of these texts are how her life is so bad and she has no other option to commit and wants to kill herself, etc. And then responses saying how much she would be missed if and don't do it, etc. A lot of this, I know 100% that she makes up stories as well as some of the stuff she has said simply never happened. I would put it down to attention seeking, but she actually harmed herself. She has light cuts on her arm and one under her watch band, which is more like she rubbed something abrasive against it other than cut it. Again, she posted all these over TikTok and captions, images, in text to these boys. She never does this or says this in chats with her good friends. And the tone with them is completely different. Clearly, she is not mature enough for social media. I have deleted it all over again and taken her phone. I don't trust her and she cannot use it responsibly. Despite her intelligence, she is making dumb decisions and not realizing how dangerous all this is. She's not an affectionate kid. And doesn't hug or anything, and I don't know how to get her to open up. She is adamant she doesn't know why she does it and can't even remember some stuff. She refuses to talk to a professional. She is very stubborn. She said if I would let her have Snapchat like to talk to her friends, it would be different and she wouldn't do stuff like that. But she wouldn't elaborate and explain, and I don't understand this. Where do we go? She's absolutely will not go to the doctor or talk to a counselor at school. She won't tell anything beyond don't know. I'm scared of being too strict as that has backfired for my parents, and I rebelled badly in my late teens, but she has shown again she's not able to make sensible choices. How do I navigate all this? She has 2 upcoming trips away for sports without me or her dad, and I'm thinking of canceling those as I want to watch her all the time. Um,
That's a tough one. I mean, she's trying to say that she's not an overbearing parent, but that's exactly what it sounds like she is. And a child,
Maybe it sounded like she wanted to talk her up so bad. She told all the good stuff.
yeah. Like also too, like she's so proud of her daughter doing all these things, and that's why she's intelligent and stuff. Like saying that kind of stuff is only gonna make her feel like she has to do it. Like,
Right.
that sounds like some parenting issues.
Yeah, she's about to be 13 and very high achiever. All that first few sentences I thought we were going to be talking about, she got hurt or something.
Yeah.
Then she went to the girl talking about hurting herself. The first comment says, that sounds incredibly difficult. She needs to speak with a professional. It is non-negotiable. Speak to the school counselor or primary care doctor for advice on navigating this within your local system. She's a child in need of support. What type of support can only be decided by a professional trained to do so. That's a physician. I need to keep a lot of these posts, get to these, in touch with them, see what they know about epilepsy.
Yeah, that'd be huge to have for the sub.
Okay, it says, oh, we can't do that. Why not? My sister is killing herself over a carnivore diet. Hello, everyone. I'm ready from Mexico, but I don't really know what else to do since it's not my case. So here I am. I'm a veterinary medicine student, and although my field focuses on animal health, I've learned enough about nutrition and sociology to know when something seems off, especially in humans. I want to share with you in case of my sister, who is 22 years old. About 5 to 6 months ago, she started following strict carnivore diet in an effort to recover from bulimia. At first, she consumed all types of meat, eggs, and butter. After some time, she realized that pork wasn't sitting well with her, so she cut it out. She also doesn't eat chicken, so her current entire diet consists of beef, turkey, eggs, and butter. While she initially experienced some improvements in her relationship with food, her physical health has deteriorated significantly. A couple of weeks ago, she experienced a full week without bowel movements, which alarmed our entire family. She saw a gastroenterologist who explained that her diet lacks fiber and value, that excessive fat intake is slowing her intestinal transit. She also consulted with a nutritionist who ran blood tests and found her lipid profile was extremely elevated. Her electrolytes were low, and her overall nutrient balance was severely off. The nutritionist told her quite seriously that her current state is dangerous and unsustainable, and explained all the potential consequences she could face if she doesn't stop, including death. Despite all this, my sister refuses to listen. She insists that by eating animals that are herbivores, she is obtaining all the necessary vitamins and minerals through their flesh. I tried to explain to her this logic doesn't hold up and that carnivore diets may only offer short-term benefits when done under supervision and never as a long-term solution. I've even reminded her that carnivore diets work for carnivores, not humans, but she continues to believe she's on the right track. I should also mention that this is not the first time she's followed an extreme dietary path. She had a compulsive eating patterns since she was about 8 years old. She began a vegetarian, then became vegan to the point of tattooing the word vegan. Later came bulimia, and throughout her life, she struggled with food in different ways. I genuinely believe this carnivore phase is less than nutritional preference and more about orthorexia. It seems to be.
Anorexia?
No, it says orthorexia. I got this one.
Really?
Yes, orthorexia.
I've never heard of that word.
Computer
You
is in
got me
front of
there.
me.
Orthorexia. Oh, that's a new one.
I got it right this time.
You did. You caught me off guard with that one.
Oh, you said I can't read. Okay. Orthorexia is orthorexia nervosa. I'm going to continue reading this before we go too off
Yeah.
topic. Let me read this. She began as a vegetarian, then became vegan to the point of tattooing the word vegan. Later came bulimia, and throughout her life, she struggled with different foods in different ways. I genuinely believe this carnivore phase is less than nutritional preference and more about orthorexia. It seems to be another way of maintaining rigid control under the guise of health rather than actual well-being. I also suspect her boyfriend plays a significant role in influencing this decision, which adds another layer of complexity. She used to see a psychiatrist or a psychologist, but stopped going and never really worked through these issues fully. At this point, I don't know what else to do or how to get through to her. I'm reaching out in hopes that someone might be able to offer any advice or perspective that could help me guide her towards a safer path. Thank you so much for taking time to read this.
Oh gosh.
So then a medical student responded saying, "You seem to have a good insight here. I agree with you that this is a eating disorder. She needs to be working frequently with a psychiatrist and probably requires some inpatient treatment. I'm not sure what the mechanisms are for involuntary admission in Mexico, but if she goes to an ER, she may be able to get help. Keep doing what you can to keep her getting better. You're fighting the good fight."
Yeah, that's all that can be really said about that situation. That's tough.
Another physician says, physician internal medicine. You are correct. It's bad. At a minimum, she should take a multivitamin and fiber supplementation. But I don't feel like either of you will get better get better through logic and argument alone. Eating disorders in many forms are usually lifelong and always difficult. My nose itches. Anyhow, we'll go to the next one. Pulsing and throbbing sensations. I have a 24-year-old male, non-smoker, non-alcoholic, currently living in UAE, not taking any meds, rarely takes any medications. I have been getting a pulsing sensation like a heartbeat continuously in several areas in the body lately. It worsens most of the time. I try to sleep, comes and goes around 8 to 10 times a day, and happens every day when I go to bed at night. Keeps me up for at least an hour, and most of the time happens around my groin. Does any of this have anything to do with any neurological issues? Used to get this throbbing sensation like a heartbeat when I was in India, but very few times. Started happening frequently since I moved to UAE.
Oh man, I've never heard of something like that.
Right. Pulsing sensation.
Yeah, in the groin area?
Yeah. That's what it says.
Did anyone comment on it?
Nope. It was only 30 minutes ago, and being that it's 1:40 in the morning,
Yeah, it's gonna be
yeah,
hard to get people to respond.
pulsing and throbbing. Okay. So it's first time seizure at the doctor's, feeling bad about it. What's up, y'all? I'm a 26-year-old female. I had a follow-up appointment the other day at the doctor's, and all of a sudden I started feeling bad, like something was really wrong, but I couldn't speak or anything. Just was thinking I should get out of this exam table, and it was oddly familiar, yet very deeply unheartening sensation. But I couldn't say the words out loud, and that's when my memory cuts out. The doctor thankfully took care of the situation. She's a legit goat. But I started coming to in on a stretcher, and I could sort of tell that there was a lot of people there too. I was more awake once I was in the ER, found out I had a seizure, but I'm feeling really embarrassed about it all, and it's never happened before. They say it was new onset seizure and likely because my lack of sleep and some of my other medications have changed a bit, but I've pulled plenty of nighters before and never had any issues. I actually slept like 3 hours in the morning that I see, but I'm more embarrassed about the C's generally speaking, like what did I do or say? My doctor said it was a bit agitated, so I'm hoping I wasn't combative per se. I also feel incredibly bad about getting sick like that and messing up the office schedule that like that. Like I know they are trained to deal with that kind of stuff, but it definitely screwed up everyone's day. I know healthcare workers are already working so hard, long hours, not enough pay. Then I go and mess up their workday because I couldn't sleep. I feel maybe it's my fault too, if it was sleep deprivation driven, and that I could have done something like told my doctor I was feeling sick sooner instead of seizing on the exam room table, or like postpone the appointment or something. I'm feeling super guilty and embarrassed, but I also so bad for my other doctor and their whole team there. Can I do anything to not feel like this was my fault?
I mean, there's there's not much you can do. You had a seizure and it wasn't, wasn't anything that you could control. Um, and I mean, there's definitely worse places that you can have a seizure. A doctor's office is not one of them. I wouldn't feel bad about that happening because, I mean, lack of sleep, yeah, that can be a trigger for a lot of people. Not necessarily saying that this person has epilepsy, but um, just, yeah, I mean, lack of sleep is rough, but some people have insomnia and they can't control the fact that they can't sleep.
Yeah, that's why we're here at 2 a.m.
Exactly.
Anyhow, we can keep it going because I'm still not tired.
Me
To
neither.
that question though, an EMT responded, and also a registered nurse. The EMT said, as a prior healthcare worker, this is what made the day not so monotonous. Monotonous, actually. Monotonous. I'm trying to say that we're glad it happened, but sometimes it's nice to put the skills to work and do something that's not in the everyday scope. I know you have some anxiety over it, but I promise you, it was quite literally just another day for them. They went home and felt good that they got to handle the situation and help you. If it makes you feel any better, take in some flowers or cookies and a quick thanks for helping me note and drop them at the front desk one day. Other than that, it was just another day. The registered nurse said, there's no reason to be embarrassed. The seizure was not your fault. You had a medical issue, and you were lucky enough to be at the exact place where you could get the proper care. No one is upset with you. You didn't ruin anyone's day. Does a mechanic get upset when you bring them a car that's not working properly? I like that.
That's a good way of putting it.
I like that. Yeah. To the female, I'm gonna get in contact with you later. So you have epilepsy and sounds, or you have seizures and whatever. You might need someone to talk to. But yeah, you don't have to apologize for seizures. Don't feel bad. I mean, unless you hurt somebody, which you didn't. So
I
yeah,
mean, even in that state of mind, like especially if she can't remember any of it, you hurting someone is not necessarily you, you know?
yeah, I know what you mean. Yeah, it's you hurt yourself. You didn't really hurt anybody. You hurt yourself. So I don't think you
Yeah,
feel that bad. Yeah, you were doing something and it happened. It happens a lot. I'm quite used to it.
it does.
Okay, it says, can I tell my mom's doctor she's an alcoholic? Not sure if it's possible. Not sure if possible. My mom, female 64-year-old, lives a ways away from me, so this would have to be a phone call. I really only want her PCP to check everything necessary and be mindful of medication choices. I beg my mom just to tell her doctor so that they can have her full health picture, but she refuses. She has HX of hypertension and anxiety, depression, currently taking medication for both, but I don't know what they are, unfortunately. Um, so this one got a couple of responses, and one specifically from a physician, pathology, I'm sorry. There is nothing legally preventing you from giving her doctor information. The doctor cannot, however, disclose anything back to you or answer any questions without your mom's permission. Then a registered nurse says, you can call and leave collateral information that would be helpful to them to know when it comes to prescribing medications. They cannot call you back or discuss our care with you. But yes, if you do tell them, they may not know. Some people are great at hiding it, and patients lie. I highly recommend AIA-non and Adult Children's of Alcoholics. That's not Alcoholics Anonymous, is it?
Um, I think so.
Okay, yeah, it says AL-Anon. Okay, I highly recommend AL-Anon, a Adult Children of Alcoholics. The former would probably recommend against making this type of call, but you have to do what you do and feels right in your soul. Lord knows I called when my mom was doctor shopping and getting sleeping meds and benzodiazepines and making them with copious amounts of alcohol. I don't wish this burden on anyone, and I wish you lots of peace. There are a few good subreddits for Al-Anon and adult children. Mm.
Yeah, it's a shitty situation.
Yeah, especially someone else to put you in for their situation. Let's another response from a physician. Okay, you can, but if your mother found out about this, do you think she'd be happy? If your mother is functioning alcoholic, her PCP will likely do nothing with this information. If your mom found out you did this, I don't think she would be pleased with you. I would caution you against doing something that could destroy your relationship with your mother. That was from a doctor.
Damn, that's kind of a cold-hearted message.
Yeah, from a doctor.
They're not even like a psychiatrist or a psychologist.
I'm sorry. Messages coming in. So that was the only responses. Someone said urgent care versus waiting it out. 27-year-old female. I had a colonoscopy and an endoscopy 48 hours ago for current pain and nausea vomiting that have been ongoing for the several years. The scopes were normal. Biopsies were taken, waiting on those results. But unless those show something, it was pretty unremarkable. I've had ongoing, fairly constant pain, have had trouble rating my pain because of ASD, but makes it hard to focus on or stand. Whereas usual, my pain is episodic and increased nausea since the nausea has made it pretty difficult to eat, but I've been managing small amounts when I can. Small amounts of fluids as well. I usually have some fuzziness and dizziness when I stand, but after prolonged sitting usually goes away nearly instantly. But today stayed for several minutes and I felt like I couldn't hold myself up anymore. Not losing consciousness, but losing vision and muscle strength. I don't know how relevant this is, but when I woke up from being under, my BP was 74 over 45, and it went up to 85 over 50. When they let me go, I tend to run around. I run in about the 90s regularly, so a little bit low, but not quite that low. The neuro in the recovery room was a little worried, but not too bad. She gave me some juice and wouldn't let me sit up. I don't want to go to urgent care unless I absolutely have to, and I would feel really silly if I went and nothing was wrong. I'm also really scared of the doctor, so I avoid the experience until my PCP, who I'm much less scared of, if I can. 5'4", 125 pounds, regular meds, Effexor, and gabapentin. History of anxiety, depression, ASD, migraines. Labs 2 weeks ago had elevated liver enzymes per my PCP. She has a lot going on.
It sounds like it could be neurological, maybe, if they didn't find anything on the endoscopy or colonoscopy.
I'm no doctor, but that's kind of rough.
Yeah.
A good one. My wife's doctor abruptly took her off of benzodiazepine. I, 23-year-old female, with my wife, 25-year-old female, for about a year now, and she has seen the same doctor for 2 years, and he is literally the worst doctor I've ever seen. My wife was taking Klonopin, 1 milligram 3 times a day for 6 years, attempting to treat her PTSD and anxiety. Her PCP ended up cutting her off cold turkey of Klonopin, and she was out of it for 5 days without proper tapering. She went through horrible withdrawals and was in constant pain. We tried to call the office and they never answer. We have to *67 the office to even have a shot at getting someone to answer the call. The doctor is impossible to reach. He never answers emails, calls, or portal messages. The doctor is hypothetically might have admitted to killing the patients, but he doesn't blame himself because they chose to take the medication. We end up going to a hospital because she was developing paralysis from the waist down and could not feel anything or walk. We were in the ER for several days to find out she's developed FND, functional neurological disorder, from the withdrawals. It turns out she is not the only person he cut off with benzodiazepines abruptly. He has a pattern of doing this, and I'm surprised he's not in prison. We don't know what to do at this point. I'm even surprised he still has a medical license.
I would file a report against that doctor.
Medical student said a few takeaways. Benzos are not an appropriate long-term treatment for anxiety or PTSD. Number 2, benzodiazepines should never be stopped cold turkey. Number 3, she should have gone to the emergency department as soon as she started showing signs of benzo withdrawal. Otherwise, this is a subreddit for medical advice, not legal advice. All right, doc or medical
Thanks.
student. Okay, someone else. Speech language pathologist. Not a doctor. I was prescribed Xanax for insomnia for 25 years. I decided to taper myself off when I turned 60. I did not want to be in the same spot as the OP's wife. My psychiatrist was shocked I wanted to taper, but she supported me by giving me 25 milligram tablets that were easy to cut in quarters. I started at 3 milligrams and reduced to 0.0625 milligrams every 10 days. It took me 9 months to taper off completely. 1/4 of a 25.25 is 0.0625 milligrams. Every time I reduced dosage, even by that 0.0625 milligrams, it felt like a little man with a baseball bat had beat the bejesus out of me 2 or 3 days after I made a reduction. The beaten up feeling usually lasted another 3 or 4 days, and then it was time to reduce again. After I completed my taper, I became peer counselor and helped hundreds of people taper off all kinds of benzos, Klonopin in particular, and very strong affinity to bind to GABA receptors, and it's difficult but not impossible to taper directly from. OP, I am sorry this happened to you and your wife. Me too. Sorry that happened to you and your wife.
Yeah, it's terrible.
A registered nurse responded. My attending psychiatrist, I'm inpatient psych, has started to leave passive aggressive comments in his initial evals. One wonders about the thought process behind TID clonazepam for 10 years. Because we are seeing so many outpatient providers doing this, psych MDs and MPs, and it's usually a real problem. Patients aren't being given the opportunity to experience and learn to cope with real emotion and stressors when everything is dulled by BDZ. I would find a psychiatrist for further treatment and appropriate taper if necessary. It can take a few years to taper off benzos, and ultimately, it's not doing your wife any good because she likely hasn't had the opportunity to develop coping skills, distress tolerance. Find a psych provider to address this and get her treated appropriately and adequately. And I am really hoping your wife has a good counselor. Another registered nurse said, are you wanting medical advice or legal advice? The bad medicine is putting your wife on a high dose of benzos for 6 years. I hope she's able to find a new solution for anxiety. that it's not benzodiazepines. I need to make sure I don't take benzodiazepines because this sounds really bad.
Are you not on any?
No, I take lamotrigine. What is that?
Well, lamotrigine is an AED, but I mean, like, Klonopin, Angels on Klonopin. I think a couple others are. I was on Ativan, which is also benzodiazepine. Basically, like used to help stop or control the seizures secondary to the AED, which is what Naslam is. Naslam is Midolazam, which is a benzo.
I got some Naslam over here.
But
Never
you just
touched
haven't
it.
used it.
I can't use it on my cell phone. It's pretty much too late, you know?
Yeah, no, I get that.
Yeah. Usually I wake up and the ambulance is here, so that means
Have
I'm
you,
supposed to use it.
like, well, you're going through changing your neurologist, right?
Mhm.
Be maybe something to talk to them about. It's like changing the medication to something that's more easily accessible for you to use.
Okay. Someone said if I check myself into a psych ward, can I really just leave whenever I want? Sorry if this isn't the right place to access. To be honest, my brain isn't working very well at the moment. For example, if I took myself there for the night and then regretted it by the next morning, can I just leave? Does it work the same if I take myself or if I call 911 and a cop takes me? Do I have to take medicine while I'm there? I've tried many things before and I haven't had good experiences. What happens if I find a way to self-harm while I'm in there? Is it illegal somehow? Do I get in trouble? How would hospitalization affect your future health care, if at all? Is there a permanent record? It goes on somewhere? I know I'm overthinking things, but it's what I do best, and I don't know what else to do right now. I just want everything to stop, and it never does, and I'm feeling like I'm going under. 34-year-old female from the US.
There's a lifeline that could probably help. I wonder if somebody commented that.
A registered nurse responded to this. It said, inpatient psych nurse. Maybe my experience is facility specific, but I doubt it. Number one, voluntary is somewhat misunderstood and not truly voluntary. You cannot leave without seeing a psychiatrist. The liability is too high if we admitted a patient who claimed to be suicidal, gravely disabled, etc., etc., and then 4 hours later, they said, whoops, all is better, and then we let them go without even seeing the doc. So while you can usually leave within a day or so of deciding to discharge, you have to see a doc first. Also, should the doc believe you are in danger to self or others and you try to leave, they could put you in a hold and you are no longer voluntary. Number two, yes, it works the same if you're a walk-in or brought in by cops. Number three, inpatient primarily medication stabilization, and if docs believe you need medicine but you refuse and are in danger to self and others, that can be grounds for involuntary hold. Number four, we make it very difficult. We make it very, very difficult to self-harm. If you do, you don't get in trouble. This is the population we see. You may have a tech assign you to that will keep you within the line of sight and closer at all times, and or be in patient rooms has observed cameras. Generally, behavioral health records. Oh, number five, generally behavioral health records are very, very, very protected. No one should know. No one should know you are inpatient except people you choose to tell. Our patients have 4-digit codes they must give to family members who want to call and talk. Without a code, we pretend we've never heard of that patient before. The paperwork isn't in my area of expertise, but short to short of a subpoena. And even then, I'm not even sure if we could disclose those records. Don't go anywhere unless you release them in writing. It sounds like you're really struggling. Inpatient care is not really something to be afraid of, and it can be super useful for acute stabilization resources for aftercare and daily access to a psych provider. We have the ability to change the meds quickly and avoid 4 to 6 weeks of waiting for side effects, etc., and can usually get you to a decent TX plan. If you're planning to refuse taking meds, I do not think inpatient care will be super useful unless you are actively suicidal, in which case, please call 988 or 911. An EMT here says, "Hi there. One thing that definitely helps this entire situation is when you check yourself in. It's not just one doctor, one appointment. Take this to see if it helps. And we'll see you again in 3 months. It's a team of working together every day to ask you how you're feeling, if what they are giving you is working, and monitor any changes. If you check yourself in, there's possibly a waiting period for them to clear you. I know you are 72 hours or so, but it all depends. You will have given them time to access you and make sure you're okay. It is not illegal to self-harm and won't get you in trouble. Tell them up front you were afraid. I hope you get the help you need." The EMT doesn't sound like he had the best advice, but
The insight nurse sounded like she knew quite a lot about what goes on internally.
is it worth amputation? Hello, I'm an 18-year-old male, and this has happened. And this happened this morning at 9:30 a.m. I was on my way to work on my bike when the chain came off while I was sprinting, causing me to fall. As a result, the half of my fourth toe was severed and landed on the road. I called an ambulance immediately. While waiting, some pedestrians helped me with the first aid and gave me an ice pack to store the severe toe segment. The ambulance took about an hour to arrive. Once I got to the hospital, it took another 2 hours before I was given an x-ray. Now it has been 6 hours and I'm still waiting to see a doctor to access this situation. I was actually told by a nurse that the bone is clean and shows no signs of infection. However, instead of attempting to reattach the skin and tissue, they are recommending cutting the bone. My question is, if the bone is clean and there's no infection, should they act quickly and try to save it or reattach the remaining part of the toe? The doctor is not showing up, and I'm afraid I'll lose my toe for real. Update: the orthopedic and the wound care nurse checked it and said that since I'm young, there's a chance new tissue might grow and cover the bone. So for now, they want to wait and see how my body responds. In the meantime, they told my mom, she's a nurse, to change the bandage every day until the next appointment in July.
Damn. I always just thought that they reattached it. That's just from movies, though.
Right, it said his toe was detached on the street. Let's see what this physician has to say. I am not a microvascular or any other kind of surgeon, but to offer some perspective on this for the OP, one must keep in mind that simply reattaching the toe is not the problem. The real difficulty is here are: one, providing enough blood supply for the reattached portion to survive. Two, I'm gonna have to read this out to you. ANASTOMOSING.
Wait, say it again.
Re-A-N. Well, there's Re-A-N-A-S-T-O-M-O-S-I-N-G. Reanimatizing. I gotta check that out.
I'm trying to look it up too.
Anastom. Yeah, I can't pronounce this. Just say it
Yeah,
by
I got to ANAS and then and then I lost it.
Okay. So ANASTOMOSING. The word is here. I can see what it means. It
And
is
anastomosis. Anastomosing. Remove part.
anastomosing. I would have never
Yeah.
knew that. Re-anastomosing refers to
Reanastomosing.
reestablishment of an anastomosis that had become blocked. It is performed during surgery to repair defects, restore functional anatomy, and make treatment possible. The term can also be described as surgical reconnection, such as tubal reversal or after tubal ligation. The arterial anastomosis, two blood vessels are attached or a single injured blood vessel is repaired.
Yeah, it's like the vascular part of reconnecting a severed body part. It's like the replantation in reconnecting the structures because there is a lot, I guess, that goes into it. Like the bones, the muscles, the tendons, the arteries, the nerves, and the veins.
Yeah.
I guess that would kind of be difficult for a toe, considering it's small and probably hard to work with.
I couldn't imagine a toe on the street.
God, that is a horrible thing to have happen. I would never want to ride a bike ever again.
Right. Never ride a bike again. I'd be traumatized.
Yeah.
The what ifs.
That poor kid.
He said, is it worth amputation though?
Well, yeah, I guess not reattaching it is what he means, maybe? Or are they gonna cut more off?
Mm-hmm. I go to the next one. Not that one. Okay. Had my embedded IUD removed 2 nights ago. Last night I had a low grade fever for 1.5 -2 hours. 1.5 to 2 hours. Should I see a doctor? 26-year-old female, non-smoker, non-drinker. No known health problems besides iron deficiency. Treated. 2 nights ago, I went to the ER because my IUD was just slightly embedded into my right side of my uterus. They removed it and sent me home. No suspicion for infection. Last night, 20 hours ago, I got low-grade fever for an hour, which then progressed to 100.5 for maybe 30 minutes, but shortly lowered to 98. It didn't take any fever reducers since it's pretty much stayed in the 97.5 to 98.9 range. Also, last night I was having a racing heart and nausea problem just from anxiety. I'm still kind of nauseous today and have a low appetite, and I'm bleeding from my vagina. Light to moderate flow. Might be a period. No foul smelling discharge. There's some pain from the scraping of the IUD did to my uterus when I got it pulled out, but it comes and goes and currently is very minimal. I'm wondering if I should stop by urgent care for this. I have health anxiety, especially when it comes to infections.
I mean, you could even just go to your your OB or your PCP and get like some urine tests, some blood work done, to check for infections. The OB would be able to do like a pelvic exam to see if there was any like damage done or something. Um, urgent care, I guess I don't really like urgent cares. That's just me though. But you could go to an urgent care. It just might take a little while.
One registered nurse said, I doubt it's an infection considering the fever came down without medication, and you don't seem to have any other symptoms I would associate with that. But it's probably worth an urgent care visit if things still feel off. If anything, it'll provide some reassurance. Yeah, those are things you need reassurance for.
Yeah, definitely.
Can somebody help me figure out what my girlfriend has? I'm requesting your help if you might help having some insight on what's going on. My girlfriend is somebody that is very smart, very, very sharp. She only rarely have access to intelligence because from my observation and hers, she has some kind of neurological issue where she is often in completely altered state, where she is dramatic personality changes, dramatic IQ reduction, slight change in voice, slight change in way she walks, slightly changes in her eyes gaze. She can also get angry easily. She realized her intelligence is deeply limited to whatever state she's in. And sometime less than once every 30 days, she gains back all of her mental capabilities and lucidity, and instantly realizes how a massive difference it is. I obviously noticed it instantly, a dramatic difference. What could it be? What could be causing this? What would be the most likely reason? Whatever this is, that was worsening by COVID, but it was really bad before COVID. It was just worsened, not triggered. This is a chronic issue she has now at 27 years old, not triggered. This is chronic issue, was around 12. She can function in life and follow studies, but with immense compensatory, I'll quit. Compensatory efforts. There we go. She often has headaches like 1 to 2 days a week. She is only lucid around 0.1% of the time. It is very rare. Inside this state, she has different personalities, switches. These personalities are often the same and recognized even though they are very different from her real life and limited. A couple years ago, urinary neurotransmitters showed multiple high neutral neurotransmitters, dopamine, serotonin, neuroadrenaline, VMA, and 5-HIAA adrenaline, more than double. Thanks a lot, everybody. I wonder what she's talking about, so I gotta check the pic. Oh, it's just showing us the level of something. I thought we was gonna see something else. Something worth seeing.
Sounds like it could be like neurological or mental, like multiple personality disorder or bipolar disorder.
Yeah, I thought we was gonna get to see her going off on somebody or something.
Video showing it.
Yeah. It says a medical student says she should really see a psychiatrist and a neurologist. This could be caused by many conditions ranging from dissociative identity disorder to even an autoimmune condition like an anti-NMDA encephalitis. Another medical student says the urinalysis is done to test the growth of the suprarenal gland produces hormones. This other word I'm not even going to try to pronounce because it's the last. It's in quotes. So these usually manifest with episodes of sweaty, tachycardia, and high blood pressure, and headaches due to this. I'm not sure how to interpret the specific values, but I hope that these have been followed up by endocrinologists. Did the start of any medications? This can cause anxiety, but I would be surprised if it did to the extent you are describing. The remaining symptoms sound like psychosomatic. Has she been evaluated by a psychiatrist for bipolar disease, depression, which can cause temporary psychosomatic impairment, and for dissociative personality disorder? I'm very carefully to use that because A, it doesn't sound like she has independent personalities, and B, it is often caused by very severe trauma that people are not always ready to face yet.
Yeah, that sounds about right.
Yeah, luckily there's doctors here to explain that stuff from us. Oh, wow. So my butt is bleeding heavily and persistently.
Oh God.
Yeah, so this is a weird one. A 31-year-old male drank heavily, like very heavily, from 21 to 30. I had a great diet and exercised pretty much the whole time. I'm also very, very hygienic. Yet I developed hemorrhoids when I was 26 to 27 years old, which I firmly believe were caused by the amounts of whiskey I was drinking. I don't strain or hang out on the toilet. I got sober September of last year. I started dipping my toes back in the water in the beginning of this month and have been good about keeping my drinking in check until last week. I've had about 4 to 6 drinks a day. Bender for about 9 days due to stress of selling my house and moving across country. On Wednesday, I started bleeding heavily. After every poop, there is no blood in my stool, but when I wipe, it's like a war zone of bright red blood. It turns the entire bowl red. I've also had very slight lower abdominal comfort, no pain or discomfort in my rectum, or usually gastro issues. I'm talking the Ocam razor approach currently and telling myself that it's most likely a ruptured hemi from an awful flare up I had a couple months ago that never burst. But obviously, the thought of it potentially being colon cancer is on my mind. Should I wait a week to go in? I don't have health insurance and I'm on very limited budget for the next few weeks. Any advice is helpful. Thank you.
Um,
For hemorrhoids, see your PCP fast.
and I don't think it would be like colon cancer, but probably like liver issues. They wouldn't cause the hemorrhoids, but they would cause like the lower abdominal pain.
I gotta look at something before I read this.
I think I might head out
Oh
soon.
shit. Okay, I understand. Me too. These pieces of I don't know what they are. Yeah, by reading it, I'll show you, but I'll just cut this out because this is female, 29 years old, 5'6", 130 pounds, no medication. I vape, no medical history. Started my period 2 days ago. Yesterday, I was in the most intense pain. I literally was thinking I just want to die at home alone in the bathroom floor. Today, bleeding, but my pain was moderate. And then this came out of me and I'm freaking out. I feel a little woozy, but it's hard. It's literally so hard, like a rock. And I don't think it's decidual cast. What is this? Someone please talk to me. Is it a fibroid? You ready?
I'm ready.
Can't get any more ready.
Holy shit.
Yeah, what is that?
I
There's
don't
another
think
picture. Hold on,
I
there's
don't
another picture. Yeah, there it goes.
I have had something like that. And it was a piece of my uterus.
Oh man.
And that's actually how I ended up with, at least from what I could tell, because they don't know how an adenomyosis forms, but they know it forms on scar tissue, and it started building up around that time when that happened. Um, you gotta go to the doctor, man. That is bad.
So a registered nurse responded. She said, not a doctor. That's definitely not your ovaries, but congrats on and condolences on passing a clot that large. When you pass clots or residual cast through a cervical opening and out through the vagina, it can cause some seriously intense cramping with severe pain, nausea, vomiting, fainting, etc. If you're still concerned, you can freeze it and take it with you to the gynecologist, but unfortunately, this is not super uncommon. When I pass mine, I have to make sure I'm staying on top of the pain medicine, or I tend to vomit and get lightheaded. So I feel your pain. That was the only response. And with that, I can say good night. See you. We've been here till 2:30.
Damn, we spent a long time.
Yeah,
We
that's about
heard
4 hours. We
we
came
heard some
around
very
11,
interesting stuff too.
came around 10:30, and it's 2:30. So that's 4 hours we've been here. That's the real late night insomnia missions.
This is gonna be a great video.
Right. I'm gonna put it out tomorrow. Tomorrow
Hey,
afternoon.
that sounds good. The Insomnia Chronicles.
Right. I think I'm hungry now.
Yeah, I'm gonna
2:30.
try to lay down, but I probably won't fall asleep for like another hour. We'll see.
All right. Good night.
Good night.